That's good. మేడం కదా చెప్పాల్సింది మనలో చెప్పుకోవాలి రాగా సార్.
ఓకే ఓకే మ్యామ్.
సార్ 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 నీ బాబు
దూరం పడుతుంది.
Good morning to the galaxy of intellectual. I am Usha Kiran, Associate Professor. Take the privilege of answering this event on behalf of Narayana College of Nursing. I feel privileged to extend my warm welcome to all the excellencies, distinguished delegates, ladies and gentlemen, with immense expectation for the 5th International Conference of Futuristic Nursing from 29/10/22 and 30/10/22. Due to time constraints, we are recording the keynote sessions. I request Madhavalata, Associate Professor, Medical Surgical Nursing Department, to call the keynote speakers. I welcome onto the stage.
అక్కడ పెట్టు, జిప్ ఓపెన్ చేసి ఆడ పెట్టు. ఫ్లాష్ పడిపోద్ది. ఫ్లాష్ ఫ్లాష్ బ్యాగ్ లో పెట్టేసి అంటే లెన్స్ మార్చుకోవాలి. అక్కడ పెట్టుకుని దగ్గరలో అక్కడ పెట్టుకోండి తీసుకుని నువ్వు ఒక పని చేయి, ఒక దాని మీదే ఉంది కదలనిలే, మరీ అంత రాదు. లైట్ ఆడొస్తుంది చూడు, ఆడొస్తుంది బాగా కదిలితే వస్తుంది. మామూలు నడిస్తే వస్తుంది. మంచి బాగుంది. ఫిక్స్ చేసేసుకో. సెంటర్లో ఉంది. పెట్టుకోవాలి. లైట్ షేడింగ్ అయితే ఏం కాదు.
కలర్ బాగాలేవా? I request the chairperson, Principal Jayantiman, Sri Narayana Nursing College, onto the stage, and the moderator, Madhavalata, to continue the session.
బాగుంది కదా చూడడానికి.
సరిపోయింది.
సెకండ్ ఉంటుంది. ఓపిక లేదు.
నీకేం పడినా ఆడుతో వాళ్ళని అడుగుతావు అయిపోతున్నారు కోల్పోతుండే.
కొత్త అబ్బాయి మా షాపులో, మా ఊరు అబ్బాయి
కోల్పోతాడు. ఉన్నాయని కోల్పోతాడు. అయిపోయాడు. అయిపోయిందా నాది
बंद कर दिया कैमरा आवाज आ रही
अभी ना बंद कर रखी है इन लोगों ने।
Your voice is mute, madam.
Nursing Institutions, Chairman, BioLeagues, TN Dr. NGR. To achieve universal health coverage under sustainable development goals. Actually, we are familiar with the sustainable development goals. There are 17 development goals like elimination of poverty, employment, then prevention of environmental pollution, gender equality, like that. At the same time, patient harm due to unsafe care is a growing global challenge leading to deaths, disabilities, reduced public confidence, and the trust in local health system. So, in one way, we are moving towards patient care, all should covered by universal health coverage, and we should move on to SDG. At the same time, in some places, when the patient comes for their care, they are undergoing some adverse event. So, the beneficial effect of improved access to health services can be undermined by the unsafe care. So, people they will have the fear to come to hospital to get treatment. So, if you take the harm, most of the harm are avoidable. What is patient safety? Patient safety is the absence of preventable harm to patient during the process of health care. When the patient already they are coming to some ailment, once they enter into the hospital, on no way they should not go for further ailment. The discipline of patient safety is the coordinated efforts to prevent harm to patient caused by the process of health care itself, and it is generally agreed upon. Please do not do any harm to the patient. Already they are under some ailment. So, in the name of healthcare or in the name of caring, we should not harm to the patient. So, what is the magnitude of problem unsafe care? On average, as estimated, 1 in 10 patients who is entering into the hospital, they are going for adverse event. And every year, about 134 million adverse events and 2.6 million deaths or disability occur due to unsafe care in hospital, especially low and middle income countries. So the social cost of patient harm can be valued around 1 to 2 trillion US dollar per annum. So these are the problems related to unsafe care. So from this slide, we are able to see that this adverse event to the patient during the health care that is happening in developed countries as well as developed countries. So it is a universal problem. So WHO took initiatives in 2019 during their 72nd World Health Assembly in May 2019. They adopted a resolution on global action on patient safety to give priority to patient safety as an essential foundational step in building, designing, operating, and evaluating the performance of healthcare. So whether actually we are thinking that we are harming the patient only during medication error, but once they enter into the hospital until they discharge or during the home care, they may go for some problems. So the hospital, all hospital, whether it's a developed country or underdeveloped country, all should take efforts to provide a safe care to the client. So all should plan to design their healthcare delivery system accordingly. Global Patient Safety Action Plan. WHO formulated a Global Patient Safety Action Plan 2020-2030. So aligned with the SDG goals, already we saw sustained development goals, and we should reach all the 70 goals of SDG by 2030. So along with that, they have formulated an action plan. So the vision of the Global Patient Safety Action Plan is to create a world in which no patient is harmed in healthcare, and every patient receives safe and respectful care every day and every time, everywhere. So whenever they are coming to a hospital, whether it is a small hospital or public hospital or private hospital, and the patients will receive respectful care as well as safe care. So this is the vision of Global Patient Safety Action Plan. And who are the key delivery partners? Patient. Patient safety is everybody's concern. Actually, if you take the who are responsible for patient unsafe care for the patient, some studies they show that 60% of errors occurs due to patient themselves. Patient are their care providers. Okay. So in the patient safety program, it requires an active participation of all key partners from government, healthcare facilities, and the stakeholders like NGOs, patient associations, professional bodies, and the WHO secretariat. So from patient to WHO secretariat, in secretariat there are different regional officers, all are responsible for patient safety. And what are the principles to get implementation of GP SAP? So engage the patient and the families as partners in safe care. So whenever we are thinking about the patient in safe care, we are thinking about doctors and nurses. So here the patient, so we have to engage first the patient and their family as partners in safe care. Achieve results through collaborative working. So we all should work with collaboration, all the stakeholders, and we should achieve results, and the results should be shared by all. Analyze and share data to generate learning, translate evidence into actionable and measurable improvement. In some cases, we are able to reduce some avoidable patient injury. That should be shared by all the persons who are involved in that. Base policies and action on the nature of care setting. So one policy, patient safety policy, is not applicable for all the care setting. So in case of primary health center, they have to develop according to their system. So like that, each hospital, whether it's a private hospital or small nursing home, all they should devise their own policy towards patient safety. Use both scientific expertise and patient experience to improve safety. So usually through evidence-based practices, we are improving our care. or services. At the same time, we should take patient experience. Some patients they will share. So what happened when they are admitted in ICU or when they are admitted in labor room? What type of problem they underwent and how they come from that problem. So this type of experience is also to be shared by all the hospitals. And what is the reason for behind the problem should be taken and that should be shared by all. Instilling a safety culture in the design and the delivery of care. So these are the principles to guide implementation of global patient safety. Okay, there are seven strategic objectives in GPSAP and it is planned between 2021 to 2030. It should be implemented. Strategic objective 1, make zero avoidable harm to patients. Zero avoidable harm. So why we are talking about avoidable harm? There are certain conditions we are unable to predict the outcome of a treatment or predict the outcome of drug interaction. So that are unavoidable. But the 90% they are avoidable harm and we can avoid them. Then build a high reliability health system and health organization that protect patients daily from harm. Objective 3, assure the safety of every clinical process, not only in medication and healing administration. So from the admission to discharge and during the home care also. So there should be safety. Taking giving blood transfusion in all process, we should follow safety. Anything and empower patient and families to help and support the journey to safer care. So the patient and family members, their involvement is very important because they are the consumers of the healthcare system. Objective 5, inspire, educate, skill and protect every healthcare worker to contribute the design and the delivery of a safe care system. Actually, here not only the patient is harmed, the healthcare providers, the healthcare providers also we are disturbed. Nobody is doing harm on their own. Okay, the all are negligible and because of workforce we are going for that type of problem. So we should educate all the healthcare providers periodically. Ensure a constant flow of information and the knowledge to the healthcare providers. So frequently in-service education, conferences like this, workshop, and we should instill the information periodically to all the healthcare providers from doctors to nurses and pharmacists and others. Develop and sustain multi-sectoral and multi-national synergy, partnership and solidarity to improve patient safety and quality of care. So all the institutions, healthcare institutions, they should share their lessons they learned during their patient care and it should be shared with all. So this is the stated framework of global patient safety challenge. There are 4 types of challenge: patient and the public. Already I told most of the adverse events occur with the patient's activity and their family and the healthcare professionals. Our role and another one medicines. Because of medicines, the patients are going for unsafe care and the systems and the practices of medication. So these 4 things they are the WHO is focusing. Next, patient safety goal. What is our goal? Improve the accuracy of patient identification. Normally, if there are 2 patients in the same unit, there are chances for so that we have to improve the process patient identification, improve the effectiveness of communication among caregivers. So handing over and taking over. So proper handing over is done. If the diagnosis we are running early and we are not handing over the communication, what are the drugs given to the patient, what are the investigation done, and what is the abnormal parameters, and it is not communicated properly. So we are always insisting, handing and taking over every shift. Improve the safety of using medication and reduce the risk of healthcare associated infection. Accurately and completely reconcile medication across the continuum of care. So what is reconcile medication? So whenever we are planning to administer a medication, we should see that whether the patient, correct patient, identification of patient, correct medication, correct dose, correct correct route and correct time. So all should be done before administration of medication. Reduce the risk of patient harm resulting from fall. Especially the patients who are having sensory deprivation, we should take measures to prevent accidents and falls. Special emphasis on dangerous abbreviations, infection control, look-alike and sound-alike medication at the time of etc. Dangerous abbreviations usually like acetylcholine 10 units, 10 international units. So some they will interpret as acetylcholine 10 IM. Like so that type of abbreviation to be avoided. The doctors, those who are prescribing, they should not use abbreviation. Okay. And the infection control already we are following biomedical waste management. And there are certain drugs, look-alike and sound-alike medication and diamonds. Look-alike some medication their labeling will be safe. And sound-alike some medication the doctor will be telling adrenaline and as approved. So both drugs are different. So that type of errors should be avoided. And the timeouts. The timeouts is very important.
Patients undergoing surgery, then from the preoperative ward, the patient is transferred to the theater. So we should take SOP, standard operation procedure, as well as checklist to avoid different patient undergoing the surgery or doing surgery. Instead of doing in the abdomen, they will be doing in some other place. Instead of surgery in the right eye, they will be going for left eye. So that are called sentinel errors. Then principles of patient safety, proper identification of patient, very, very important, and prevention of patient handover error. Already I told, we should avoid handing over error. It should be properly done. So we should move from every bed to bed and we should tell the patient name, age, diagnosis, and what is the problem with the patient and what are the drugs he is taking, what are the investigation done, and what is the plan for the next day. Like that, we should hand over. And assessing medical accuracy while giving care to the patient. Already I told, when you are planning for medication, whether it's a oral or IV or IM, we should take the medical consideration, performance of right procedure at the right body side, that is not to prevent sentinel error, take appropriate precautionary measures to avoid infection. So following biomedical waste management. These are the principles of patient safety. If we are nurses, because we are nurses, we are always the patient. When we are following all the processes in patient care, so around 80 to 90% of errors may be avoided. So the kinds of safety, number one, environmental safety, medical safety, surgical safety, equipment installation safety, and electrical safety, laboratory safety, sanitation, infection control, and biomedical disposal and blood safety. So these are the areas the patient safety may be compromised, and we should be very careful when we are doing each process. Work environment safety, there is a direct link between work environment and the patient safety. Already told, not only the physical environment, also the work environment. When the nurses they are loaded with more patients, there are chances for errors. Then environmental safety, physical environmental safety, there should be adequate light, adequate ventilation, and stairs and handrails, and window door closures, sleep preventive closures. So already you are familiar with this. So the physically, the environment should be friendly for the patient. The medical safety, already we saw the medication, the illegible writing prescription, the doctors should be avoided. And whenever you are dealing with this, we know. So there should be no air bubble, and the patient should not go for over dehydration or hydration, and the good street all should be carefully evaluated. So the medication order should be written medically unique, and it should show patient name and the location, the ward, room number, bed number, etc. And the medication generic name. Instead of prescribing patients, the drugs generic name should be used, then dosage, frequency, and the administration as per as timing and the signature of the physician and the date and the hour of order return. So whenever we are receiving a medication order, so we should check whether all the
are available.
అసలు
Then surgical
Disturbance
safety,
వస్తుందా? Original
information of the
వస్తుందా?
patient, proper identification of the patient, name, wristband, then proper identification marks on the pass. Now nowadays they are walking the surgery site
ఇది మొత్తం
and
ఆడియో
the pre-anesthesia
కెమెరా
checkup, anesthetic safety, ensure there is no foreign body left inside. So sometimes we are getting seeing in the paper. The patients after undergoing surgery, the pads are not removed, or scissors are missing. So it is actually a major flaw, and we should ensure there is no foreign body left inside the patient, and the safety measures are brought to OT and coming back. So the patient is shifted from pre-operative to OT, and the safety should be shifted from the OT to post-operative ward. We should take all the measures for the safety of the patient and the prevention of surgical wound infection, use of surgical safety performer in all operations, and to check safety code was available. Okay, and we should be familiar with the other color red for allergy, yellow for risk, and purple for do not exist. And there are chances for installation as well. Nowadays, we are using so many equipments, so there are chances for the cost of the equipment that we need to patient and safety and it should be regularly checked. Then electrical safety, all the safety measures like safety users, no loose wire, and properly plug the electric stand and avoid in case of short circuit. The patient is ventilated. Okay, and we should call electrician and we should take all the safety measures related to electricity and also fire safety measures and also blood safety measures. Okay, in blood safety, proper grouping and cross matching and the test for HIV, hepatitis and VDRL, proper leveling of group and the name of the patient and avoid mismatch of blood like that. Then sanitation, infection control, bioinformatics management. From collection to disposal, we should follow the policies and the laboratory safety, avoid needle or stealing of blood, safety measures in radiology and radiology department, safety guidelines for different areas of hospital, regular test control measures to avoid the rat and other things. And handling acid, reagent and inflammatory substances and the biomedical waste segregation and the disposal. So tips for improving patient safety, constitution of the patient safety committee. Every hospital, whether it's a small hospital or the tertiary care center, there should be a patient safety committee. Develop clear policies and protocols for patient safety. Discuss regularly patient safety initiatives within the hospital. Then orientation and reorientation of the healthcare providers regarding patient safety. Encourage transparency in the regular death review. In case if there is a death occur, usually all the hospitals they are doing at the end of the month death authority or mortality audit, and it should be done genuinely. In case if there is a flaw, it should be identified and the measures should be taken to prevent it in future instead of hiding. And the non-punitive incident reporting by staff. In case if I am working as a ICU, I committed a mistake. Immediately I should tell my superior officer. So instead of giving this instruction, I gave them instruction. So there are chances for recovering the patient from the witness. If I find or if I tell us they will punish like that will result in patient death. So we should promote non-punitive incident reporting by staff. Each department will devise their own safety protocol and investigate each accident and incident reporter and take remedial measures. Already I told them we should report if anything happens. Untowardly it should be reported and remedial measures should be done and review, monitor and evaluate safety procedures regularly. So in this session, the take home message. Always we should have a presence of mind.
ఒకవేళ ఆయన తీసినా ఆయన బ్యాక్ కనిపిస్తుంది.
Okay, if you are having presence of mind and you are working with the patient or working in the hospital setting always your mind should be applied to the situation. So that you can sense the error easily and act to be prevented. So whenever possible, not possible, 100% you take measures to prevent the error and always follow safety guidelines. Don't skip safety guidelines, follow and encourage into accident and death. If an accident or antibiotic event occurs, it should be encouraged and it is not to punish the person. It is to identify the decent behavior and take preventive measures and all these measures are the responsibility and the responsibility and the responsibility of all the stakeholders. So with this, I am coming to the end of the session. Thank you all for your patient listening. Thank you, ma'am. Any questions for ma'am? Hello. Good morning to everyone present here. This is an active session we started with today's program, that is our fifth international conference, Futuristic Nursing. Going beyond our higher level. And Dr. Kumari has very covered the points very important for patient safety, that is recent trends in patient safety and healthcare. She has very covered from what are all the problems of unsafe healthcare and what are all the strategies our WHO has formulated for a period of 10 years and how we can follow safety measures in almost all the areas of our care provision. So from that point, so the small, very simplified manner, she has explained what are the main principles. That is correct identification and by how to identify through proper communication. And handing over error. See, as nurses, we always miss something or sometimes the handover may not be followed out and correct procedure. For the right patient, right procedure and avoid infection. So very covered. So ultimately, how to achieve this? Every time we formulate, not we, the healthcare providers, agencies, stakeholders, we involve in our own activities. How to provide or how to follow this safety measures as nurses. And in very manner, like very simple like for the student, she has covered very nicely. I congratulate Dr. Kumari for presenting this topic. So ultimately, how to achieve the recent trends, I can just share few things. How to achieve this cooperation as a viable strategy. See, unless you cooperate with the team members, this safety of patient care may not be achieved. That is cooperation is a viable strategy and personalization of care, very important. Personalization of care and workforce diversity. Workforce diversity is expected from each nurse. Wherever maybe in the sector, wherever maybe providing maybe in the acute care center or in the community, that should be like, it should be in a diversified manner. And above all, we must merge and integrate. Integration and learning is utmost important for our nursing care. Thank you very much, Dr. Kumari. Now, I request audience, anybody has any doubt, we can throw the questions to the presenter. Thank you.
బొమ్మలు ఉంటాయి కదా, ఫోటోలు కూడా తీస్తాను. కాదు, నేను రహీం వెళ్ళాం తీసుకొని వచ్చాను. ఇంట్లో కూడా పెట్టాను.
I request all the students, please check out the QR code here on the screen, and please do the pre-test. And who don't have mobile, faculty can be shared the pre-test QR code in your group so that you can do the pre-test later also. Yeah, please take 2 minutes to take the scan, and you can take a photo also. You can share the photo for your friends.
ఎలా స్కాన్ అవుతుంది దూరం
ఏంది
క్యూఆర్ స్కాన్ దాన్ని స్కాన్ చేస్తే ఇది షేర్ చేయొచ్చు అంట.
ఏంది
జరగదాన్ని తెలిసి అక్కడి నుంచి స్కాన్ ఎలా అవుతుంది?
I think it's okay for all of you. Can we proceed with that? Now, let's move on to the presentation by Mrs. Usha Kiran, Associate Professor, Department of Obstetrics and Gynecological Nursing, Narayana College of Nursing. Mrs. Usha Kiran is permanent in teaching the students, and she completed her master's degree in OBG and pursuing PhD in nursing at Lincoln University, Malaysia. She has more than 10 years of teaching experience and currently working as associate professor in OBG and Dr. NTR University, Andhra Pradesh. She presented research papers at national and international conferences and seminars, workshops. She deployed as an examiner for UG and PG examinations from the university. She is a member of Research India Foundation and Book Review Committee, published original research articles in Scopus and other index journals, and hosted to international web conferences, and she selected as a PhD guide for the NTR researchers. It's my immense pleasure to invite you, ma'am, for presenting the topic Advanced Nursing Practice. I welcome you, ma'am. Thank you.
మేడం అయిపోయాక లైవ్ పెట్టి పెడతాను, మళ్ళీ వచ్చేసాను.
Thank you, Malati, for your kind words.
మేడం ముందు షాడో పడుతుంది. ఇంట్లో పోయి దీని ఆడియో కాదు, సరౌండ్ ఆడియో మనం మాట్లాడుకొని ఇంట్లో పోతుంది. సో అది
వాళ్ళకి పర్లేదు సింగిల్ ఆడియో పంపించమని డిస్టర్బెన్స్
వీళ్ళు ఇవ్వాలి, వాళ్ళు ఇవ్వాలి.
చెప్పొచ్చు అమ్మా. ఆడియో టేబుల్ ఓన్లీ ఇక్కడ మాట్లాడేది అర్థం అనుకున్నాను
బాబు. నాకు అతను ఎస్డీ ఇచ్చాడు, ఇది హెచ్డిఎంఐ ఇస్తే నాకు మన ఆడియో పోతుంది.
నీకంటే ఇచ్చావు కదా టేబుల్,
హెచ్డిఎంఐ ఇవ్వాలి.
Today the topic this is known by all our BSc nursing students as well as MSc nursing students. The subject is there.
Money.
Here under this topic of futuristic nursing,
హెచ్డిఎంఐ టేబుల్ ఉంది.
the advanced nursing practice, we are talking about little new things related to the futuristic nursing. So under this advanced nursing practice can mean many things to many people. These highly knowledgeable and skilled nurses are increasingly in popularity and solution to many of the challenges that healthcare faces towards advances. So here, what I need to say here is, everybody thinks advancing in the nursing practice. We have stated many concepts like the challenges what we face every day, or the technology what we face every day, or the increasing competency in the health services, changes related to the healthcare delivery system, and also the application or the application healthcare needs which have been increased nowadays. As the upgradation is very essential as the part of advanced nursing practice. So many trends in nursing are likely to develop in the near future. Some can predict with certain things which are unexpected. Failure due to the COVID pandemic, lot many changes have been made in the curriculum as well as in the health sector also. A very rapid changes are part in the future also, where this is needed as a futuristic nursing which involved in the advanced medical practices and the nursing practices where we need more technological involvement. So as the 21st century approaches, opportunities facilitate movement toward the goal of full professional status. If nursing is to fulfill the social mandate of providing optimum healthcare to society, the nurses should be the responsibility. So here, what we are going to see here, we are the major people doing the care and taking care of the patient for a long time, and also we are eager for the responsibility of committed care for the patients. So for nursing, to become a recognized scientific profession, so what we want, we need to improve the skills and also we need to improve in all the technological advancements which are there related to the advanced nursing practice. So especially those referred as a professionals. So we people are professionals, and under the professional umbrella, we are there to uplift ourselves in the advancement of the care. So the rapid and complex changes in the health system worldwide continue. Who can be a preceptor. So in the past, educational programs were delivered to graduate nursing students who attended on-campus classes during face-to-face lecture. The proliferation of asynchronous and synchronous distance education programs for nursing practices are allowed. So this is making us to go for a further improvement and enhancement of knowledge, which will be helping us in making the students as well as the nurses to be in the continuous educational program. So in order to support and add to the advanced practice nursing, educational preparation, so in the educational preparation, beyond the generalization of the nursing education, formal recognition for the educational programs are needed. So formal recognition now, GNM is there, and also we have post-BSc nursing programs, and also now we have included so many doctoral programs and certificate courses and other diploma courses and other so many career-oriented courses have been included, so which will be helping us in including lot many knowledge enhancements in formal system of the licensure registration and certification and accreditation process. So it may help the advanced nurse practitioner articulate professional roles, identify and function, framework for organizing all the practice nurses believe the knowledge about their role and practice, use to differentiate among levels of nursing practice. So how they have to differentiate or how they can become professional in the organization and how they can articulate the professional roles can be identified and the functions can be differentiated in this aspect also. What that is the purpose of the advanced practice nurses, and to facilitate a common understanding and to guide the future development of advanced practice roles. So we people have to think about how we need to develop ourselves by advancing the nursing skills and practicing the maximum in-depth nursing knowledge and skill in meeting the health needs of the clients. So in-depth needs in the sense how we can develop all the in-depth needs for the clients, like advanced nursing care plans and the cards what we follow and what we regularly do the protocols and each follow-ups and the SOPs what we do, everything are advanced now. So these all the advancement skills are essential in advancing our knowledge in the nursing practice. So as a nurse practice development unit, so any unit what have to develop here is so networking communication. So everybody should have a networking communication in the sense a continuous communication is needed here, and undergraduate nursing students is support. So here, without student nurses or student nurses development is not there, our advancement or any skills will not get uplifted. So all the undergraduate nursing student support to be there, which will be combined in the networking communication. And leadership and facilitation. So the leaders who are there as a nurse practitioners, those are the leaders and those are facilitating the people to go continuously in the way how they can go with the quality improvement process and enabling and sustaining changes. So what are the enabling and sustaining changes? So lot many changes will be there in a particular aspect. So they will be easily understanding as a quality development in charges or quality assessors, they will be continuously enabling and sustaining the changes for that, and concluding with the research and evidence-based practices, they will be ensuring with the continuation of the involvement of all the entrepreneurs and also involving in the very developed networking sources for the students as well as the nurses. And what is the role in the advanced nursing practice? So nature of practice, what sort of nature in the nursing practice we have? The ability to integrate research. So evidence-based practice here, that is a very, very important thing as evidence-based practice means we are evidencing here and the clinical management has high degree of professional autonomy and independent practice of safe management has own case holding and we will be doing the advanced management, decision making skills and diagnostic listening skills will be continued as a role of advanced nurse practitioner. So recognizing the advanced clinical competencies, the ability to provide constant services to other healthcare professionals. So as we are multidisciplinary and we will be continuing our services along with all the professionals. So a constant service to the healthcare professional and recognizing the competencies and advancing the skills are very, very important. And the plans what we do and implement and evaluate programs and recognize the first point to the contact of the clients. So we are going with the client-oriented services where our client-oriented services will be recognized and then planned, implemented, and evaluated, and continuous research process will be going on in the advanced nursing practice. So nurse in advanced practice roles are increasingly viewed as a vital part of the healthcare workforce. So the workforce means here, we people are under the very great pressure due to so many administrative difficulties and lot many other things. The workforce, whatever we maintain, should sustain in a manner where we can continuously give a good care to the patients, which will be helping without any shortcuts. So this section identifies and describes the motivation or incentive leading decisions. So here, the case managers are the managers who will be taking the role of an advanced nurse practitioner to identify who is doing well and incentive programs or any sort of educational programs to be continued and investigate and perceive the concept of advanced nurse practitioner and associate with the advanced nurse practice roles. So a separate differentiation to be continued to the advanced nurse practitioner and also the roles to be differentiated and associate with the roles and develop the skills among the teamwork who are there. So other implementations like the healthcare needs of the population here, education for the nurses. So we need to continue with the continuous including improvement of the skills for them and doing some other courses and workforce issues to be continued and to be solved and practice pattern and new models of care. So whatever the new models are there according to the care related, those things to be improved and people who are with so many nursing models have been developed nowadays. So those models will be discussed and how they are solving the problems can be discussed. And so the role enhancement with the evidence-based practice can be continued. Legal and policy context. So in the legal and policy context, definitely every nurse has to understand what is the legal aspects are there in the caretaking aspect, and also policies are there for every procedure what we do, and also the policies what we follow, like the SOPs that will have a very good impact on our care delivery. So must include advanced physiology and pathophysiology and all the health assessment skills and advanced pharmacology and here. So these will be helping to enhance the knowledge regarding all the basics as well as the advanced skills for it and principles of decision making. So the time where they have to take decision and where they have to keep quiet or where they have to move forward. These all the aspects are very, very important. And core competencies. So they need to include not only core competencies like communication skills and interpersonal relationships with the patients, and continuing with the role presentation and how to maintain the case role. All these aspects are very important. We all will have to make a constant effort to keep informed through all available sources. So as we all are educated and also the nurse educators, we have to keep available sources to nurses and nursing students or the team who we have. A constant continuation of information to be given for them, and it is the only way which will help you to know about what is happening in present and what will come soon. So the advanced now, a lot of nurses are lacking the advancement. Now a lot of improved technologies are not identified or not well versed, or they are not having better hands-on training for them. So these all are the implications which will help us to improve in the advanced nursing practice. Thank you. Thank you, Nisha, for the wonderful presentation on advanced nursing practice. As we grow, like our profession grows, we are also improving. We are not just in any other professions. So she has covered almost all the areas where a nurse can do advanced practice. So what is the principle or what are the things we expect from the advanced nursing practice? Then must possess high degree of autonomy, leadership who is ready to initiate change and demonstrate of advanced judgment, and she should be a critical analyst of on health policy, making health policy, ability to explain and apply the theoretical, empirical, ethical, and experimental foundation of nursing practice. Few qualities or few principles which guides or these are the guidelines for a nurse to become an advanced nurse practitioner. And then what are the areas we do started practicing or mobile nursing services, the areas where advanced nurse practitioners can function as independent with lot more autonomous. Mobile nursing services, military nursing services, occupational health services, school health services, and nursing robot, and space nursing society and tele-nursing. These are the areas. Now it is just lining up, or in developed countries it is already there. So in our setup also we look forward for the young nurses to take part in this advanced nursing practice area. Thank you very much. Now the audience can have, if you have any doubt, you can ask the presenter. Thank you. Any questions from the audience? Otherwise, we move on to the next presenter. Okay? Okay.
May I now move on to the next presentation by Ms. R.T. Girija Rani, HOD, Department of Nursing Research, Narayana College of Nursing. She is passionate in teaching to the students by innovative methods. She has completed her Masters in Pediatric Nursing from Narayana College of Nursing, affiliated with Dr. NTR University, Vijayawada, AP. She is having 3 years of teaching experience, currently working as a HOD and Department of Nursing Research in Narayana College of Nursing, Nellore. She has presented research papers at national and international conference. She published many articles in national and international nursing journals. She conducted various seminars and CME and FDP programs in Narayana College of Nursing. She guided 24 research projects to UG students. She is in charge of NAC Criteria 7 and undergone for NAC inspection. I request you, ma'am, for presenting the topic on new technologies in nursing education and practice. I welcome you, ma'am.
Persons and all delegates and all my friends and my colleagues. I think good morning everyone. Today I am going to present the topic on new technologies in nursing education and practice. So coming to the introduction, the technology has become more popular as a medium for teaching and to imperative to today's learning environment. There are number of modes of technology utilized in nursing education today. For example, high and low fidelity simulation provides students with case-based scenario and the opportunity to practice hands-on skill. The many educational facilities have concentrated on embracing educational delivery changes through reconstruction projects and budgetary amendments and improving support to educators. So the technologies in education should have divided into three methods: simulated environment and online education and mobile technology. Then coming to the simulated environment, the use of technology in nursing education is simulation with the electronics and training mannequins. The instructors can program the mannequins to mimic serials and nurses might see the clinical practice. Students can take vital signs and make the decisions based on the mannequin symptoms. The emerging use of game-based learning has the same benefit of learning in a simulated environment. Gamifying nursing education has a capability to capture and stimulate the students in attention. It also encourages the development of skills like critical thinking and innovation and information retention. The most important thing, so however, the students they can practice in low risk environment and as well as so they are practicing in real patient's life to in low risk. Then coming to the online education. So one of the biggest changes brought by the technology is the availability of online degree programs. Online degree education operates through the learning management system. The software programs handle all parts of learning process, including delivering the content and handling the registration of all courses and tracking and reporting. Nursing programs can choose for a number of different systems. Each offering have different features and benefits. Then mobile technology. The use of mobile technology in nursing gives the students instead of access to drug references and diagnosis and medical textbooks and more using apps and online guides and smart mobiles and tablets. The mobile technologies have highly valued and used in healthcare setting, noted that healthcare professionals use smartphones and tablets most often to achieve better staff coordination and as well as to improve patient communication and gain easier access to electronic health records. Impact of technology in nursing education. Nursing education has to prepare clinicians to promote health and increase well-being, and as well as we have to enhance the nursing students their capacity of education, and as well as we have to need to redesign the many countries in their technology, and as well as the technology has many benefited, but there are huge gaps in technology access and training the nurses education. Other challenges including understanding about how technology influences on the well-being of patients and clinicians and learners and educators. The technological innovations and improved globalization or interlinked and nursing education has to respect in measures by careful executed in way. Technology in nursing practice. So we have divided into three categories: e-health services and telehealth nursing and robotic nursing. In e-health services, the use of information and communication technology for health and refers to as a e-health represents a mean of supporting healthcare delivery. This technologies can change the nursing plan and care delivery and documents and reduce the clinical care, and as well as it have continuous technological advancement. The process of whereby the nurses receive and review the diagnostic information and make clinical decisions and communication and socialize with the patients and their relatives, and as well as implement the clinical interventions will be fundamental modified with the further integration of ICT into the nursing practice. Telehealth nursing. The telehealth nursing is a direct communication between the patient and healthcare providers. It integrates information and technology to facilitate healthcare delivery, and it removes the time and distance barrier via video phones and video cameras. The telehealth contributes to positive outcomes in the terms of self-management and appliance. Coming to the robotic nursing, the robotic nurse has to be in hospital, and the brain the robotic posting in outcome. The body of robotic nurse is developed by the Samsung, and the University of Auckland or created a nurse knowledge base. So she has face recognition by camera and video recognition by microphones and arms and hands. She talks with the patients and doctors, nurses in 8 languages. So another responsibility
Right,
is
camera,
table patients who doesn't have any visitors. So coming to the nanotechnology industry, nanotechnology is a use of atomic molecular structure as core building to create new products and devices. These devices and products, it will be called as nanomaterials. The nanotechnology provides a significant way of diagnosing and treating and the prime position of ingredients and advocate for safe use of new technologies. New pharmaceutical and drug delivery mechanisms also they are following, and they have invited patient monitoring devices, and they are regenerating the sciences. When coming to the electronic medical records, it have solo practice, and they have to use smart beds and centralized facility and centers, and telehealth apps also have example of high-tech devices and medical sectors, how they are using in day-by-day routines. Nurses play an essential support role in their field, and as well as they are required to take great urgent knowledge to carry their routines to improving their innovation practices. Thank you, Ananda.
Thank you, teacher, for presenting the topic on new technologies in nursing education and practice. As this topic is very well covered by earlier Kiran, same, like nurses are not only starting with the clinical nursing duty, and they are also taking up some advanced courses, and they are practicing nurse specialist, nurse consultant, advanced specialist in midwifery care, and a nurse researcher, and doing some tele-nursing also. And the topic is very well covered by Girija. Any questions, any doubts from the audience can get it clarified from the presenter. Delegates, any doubts, clarification regarding advanced trends in nursing practice? Okay, we proceed with the further session. Thank you.
వస్తుందిలే. టేబుల్ తగ్గనా? అలా బయట అదే బిగించానా? లూజ్గా ఉన్న బిగించాను. టేబుల్ ఇదే తరగతి. ఏమన్నా కాస్తుందా? ఏం కాస్తుందా? లేదు కదా. ఏమి చెప్పిందా? దీన్ని నమ్ముకుంటే మోసపోతుంది. అది కరెక్ట్గా లేదు. మోసం.
Thank you, one and all. And the dignitaries has arrived. So we are waiting for them. So let us wait for a few minutes as the program will continue. Meanwhile, please proceed with the pre-test, which you have already scanned. Once again, your code is displayed. Please carry on with the pre-test. Meanwhile.
బ్రో అయిపోతే కొంచెం వెనక్కి వచ్చేసింది ఒకసారి. క్లోజ్ చేయాలి. లక్ష్మణ ఒకసారి ఆ డోర్స్ క్లోజ్ చేసి డోర్ క్లోజ్ చేశారు సార్. ఎవరు వస్తున్నారు?
क्या रही है फिर आप मतलब
नहीं छुट्टी दिलवाएंगे अभी बुधवार को मेडिटेशन फिर उसके बाद हम ब्रह्म कुमारी वगैरह से काउंसलर को यहाँ ले गए दिमाग शांत पापा को कटवाए रहे हैं पंडित तो परेशान हो रहे हैं। वो 2 लोग आ रखे हैं इस चक्कर में। मेरी दादी ने बुला लिया मेरी बड़ी मम्मी को और मेरी बुआ की बेटी की बुआ रखी है। 2 जने आ रखे हैं।
यहाँ से कहाँ जाती है?
मैं आपसे घर ही जा रही थी। आज कल मेरे भाई की नाइट थी तो बोले मैं रुक नहीं पाऊंगी तो चली जा। मैं घर चली गई थी फिर मैं 10 बजे भाई हमारे पास ही रहता है। वो भी जॉब कर रहा है ना। अभी जॉइन किया Concentrics Gurugram
హలో వీళ్ళెందుకు మధ్య క్లాస్ కొడుతుంది వారి పేరు
पांडे जी आपने थोड़ा स्पेकुलम सेट आज अब अभी पेशेंट नहीं आया था ना इसलिए मैंने बोला
బాబు బాబు సార్ కొంచెం వెనకరండి మీరు. Arun, cepat. Arun, wait.
आप ये ना आप एक काम करिए नीचे से ना एक पेन से ऊपर की ब्लू कराने हैं और एक आपका इसी के नीचे हो जाएगा इनको दिखा दीजिएगा ये to the galaxy of intellectuals. I am Shakiran, Associate Professor. Take the privilege of anchoring the event on behalf of Narayana College of Nursing. I feel privileged to extend my warm welcome to all the excellencies, distinguished delegates, ladies and gentlemen, with immense exultation for the 5th International Conference on Futuristic Nursing from 29/10/2022 and 30/10/2022. So let us start our program with a prayer song. It's a mark of our underlying tradition to invoke the Almighty at the beginning of an important event. I want our following voices of first year BSc Nursing to lead the prayer and let us all stand for the same. क्या करेंगे क्या फाड़ दिया मैंने इसको Yes. छोटा जब सेट करके तुमने बोला अच्छी बात होगी अप्रिशिएट करना भी चला गया रजिस्टर भी मुझे यही बोल रही थी अभी बोल रही थी दीप्ति जी ऐसे बोलती
Thank you for your wonderful prayer song. I request welcome song students to sing our welcome song. I welcome first year BS nursing students onto the stage.
in your hands and songs on your lips to the timbre of love, to the timbre of love. We welcome you here, we welcome you here to the world of failing light, to the world of light. The brighter the light will bind us together. Knowledge and wisdom, oh, service forever. Will meet the desire, will make us so higher. We welcome you here, we welcome you here to the world of failing light, to the world.
Okay. A light
Thank you girls for your welcome song. Dance is surely the most basic and relevant of all forms of expression. With that, I welcome second year basic nursing students for the welcome dance to welcome all our dignitaries. Thank you girls for your excellent performance.
ఏం కాదు ఇన్సైడ్ సగం టక్కన పెట్టేస్తారా
ఇందాక కదా ఇది దేనికి సంబంధించింది అన్నది
ఆటో లైటింగ్ అంటే ఇప్పుడు ఆఫీస్ ఆటో లైటింగ్
టమాటో కొడతామా ఇచ్చామమ్మా వస్తుంది అసలు ఏం లేదు బాగుంది
దేవుళ్ళు అంటే అక్కడ పోయినట్టు కదా పక్క ఇంకోటి ఏంటంటే ఎందుకు ఉన్నాడు రాసుకో
అది ఉంది ఇది వెనక్కి ఇది ముందుకు ఇది ఉంది కొద్దిగా ముందుకు ఓకే
మనీ మనీ వాళ్ళ లోగో పెట్టమను కూడదు లోగో పెట్టక ఫోటో ఏమంటారు వాళ్ళ పైన స్క్రీన్ పైన వాళ్ళ లోగో పెడితే ఒక ఫోటో తీసుకుంటారు బాబు వాళ్ళు లోగో పెడుతున్నారు ఒక ఫోటో తీసుకుంటారు మనీ మనీ ఏ ఆ మనీని బిల్లు నాకు కాదు నాకు ఇంకా రాకి ఆ మనీని బిల్లు కుర్చీలో కూర్చోవాలి అబ్బాయి
కలర్స్ కూడా కొద్దిగా పెంచమన్నాడు అని చెప్పేసి
వాళ్ళ యోగా పెట్టాలి ఫోటో తీసుకుంటా
Dr. Ravi Kumari, Vice Principal, NAC Coordinator, Head of the Department of
బాబు కెమెరా వస్తుంది కెమెరా వస్తుంది మళ్ళీ అంతానికి వేసేద్దాం
Excellencies, ladies and gentlemen, good morning to everyone and thank you all for being here. Your presence is appreciated, especially in this morning. On behalf of Narayana College of Nursing and the Society of Nursing Practice, I, Dr. P. Kumari, Vice Principal, HOD, OBG Nursing, Narayana College of Nursing, welcome you all to the Future International Conference being conducted on the topic Futuristic Nursing, Navigation Towards Horizon. Ever since its inception and almost all the past 2 decades of its existence, Narayana nursing institutions are in the vanguard of upholding the high standards of professional dignity and decorum, which goes with any noble profession, more to the nursing profession. It is a matter of great satisfaction that the nurses turned out by this institution are providing
excellent valuable services to the society, not only in Andhra Pradesh, but also in other parts of India and abroad. The current trends in nursing and care are multifactorial, and innovation in nursing is fundamental to ensure and develop quality of care. Narayana College of Nursing has always ahead in predicting trends and preparing the students, and this conference is futuristic nursing, education beyond horizon is
లేదంట
one
వాళ్ళ
such
వాళ్ళ
example.
లోగో పెట్టండి ఒక ఫోటో తీసుకుంటామని చెప్పా లేదంట లోగో
This year, when we are conducting the 5th International Conference, and we have a history to tell. In the year 2003, the college was established with an intake of 60 students. Almost after 20 years, the strength is tenfold. Narayana College of Nursing stands before you as one of the top 10 nursing colleges in India, and still rising as the non-compromising, strongest nursing institution, which is recently being accredited by NAC. Also, we sincerely hope and work for the reputation of our college continues to grow. Today, we are all proud to be part of such a prestigious institution. It is a significant day for our college as it is hosting its 5th International Conference with around 1,200 participants and 10 international delegates. It is a matter of great honor for all of us. First of all, I welcome our founder, Dr. Narayana Garu, who have foreseeing vision towards education, a philanthropist, a social activist, along with the silent social change through education and healthcare services. In this success, I am welcoming you, sir, and we are praying for your blessings as usual. I am overwhelmed to welcome our versatile, talented, young and dynamic leader, Executive Director, Narayana Group of Educational Institution, Shri Punit Kotaka Garu, to this inaugural session in his absence. We look forward to the presence of our beloved and respected Dr. Sindhura Narayana Garu, Managing Director, Narayana Educational Institution. We are delighted to welcome you as in your absence. I would like to welcome our chief guest, Dr. B. Valli, Deputy Director Nursing, Directorate of Medical Education, and Registrar, Andhra Pradesh Nurses and Midwifery Council, one of the pioneers and leaders for the development of nursing profession in Andhra Pradesh. With us. Hearty welcome to you, ma'am. Let me invite a woman with perseverance and an able administrator who is known for her best administrative skills, dynamic leader, passion towards research, and who is traveling with the Narayana Educational Institution from its inception to this stage. We look forward the presence of our beloved and respected nursing dean, Dr. Indra, to the stage and occupy the dais. A well-known academician for his in-depth medical knowledge and an experienced administrator, always supporting Narayana College of Nursing for its upgrading efforts I invite our guest of honor, Dr. Vijay Kumar, Registrar, Narayana Medical College, to come to the dais and make the program meeting. May I invite our guest of honor, Shri Dr. S.T. Rao Sir, Dean Narayana Medical College, who is always supportive and an active team leader, recognize and give importance to nurses and nursing faculty all the time. I am glad to invite you, sir, to the stage. It is my privilege to welcome Dr. Ajay Veginar, Principal Narayana Dental College, on this day, whom we refer as ready reckoner for all academic activities and who never says no to our request. I welcome you, sir, to the dais. I welcome Dr. Sivakumar, Academic Dean, Narayana Dental College, to occupy the renowned chair in the dais. I welcome Sri Ramarao Garu, who is always a backbone and supporter to the Narayana Nursing Institutions, operational head, and administrator to the dais. I welcome Shri Shri Kumar Sagar, MD, Society for Nursing and Nursing Practice, to the dais. They are women with a multi-talent, very experienced in clinical nurse deployed in India and abroad, and a native teacher and administrator. They are good humanitarian with a warm personality. I welcome Professor V. Jayanti, Principal Sri Narayana College of Nursing, to grace the stage. I welcome you, ma'am. It is my pleasure to welcome all the delegates and keynote speakers for the conference from all over India and abroad. Your presence is highly appreciated by all of us. Welcome you all. I welcome all participants in different categories who are excited to present their ideas and views on the topic of discussion. A warm welcome to all the nursing faculty and students representing various colleges of nursing. Last but not least, I welcome the faculty and the students of Narayana College of Nursing and Sri Narayana College of Nursing for this conference. I also welcome our in-house
media persons, technical support staff, and external media personnel who are here to support and support us throughout the conference. I wish you all a very pleasant stay, memorable time with the Narayana College of Nursing. It is our pleasure to host you or to give you a platform to continue the discussion on the theme Futuristic Nursing. With the love, respect, once again, welcome you all.
Hey, okay, on the battery is charging bit. Jippy camera back.
Welcome, ma'am. I request Komana ma'am onto the dais.
Madam, wait. Madam, please wait. Condition.
Thank you all the dignitaries. I request all the dignitaries to come forward for the land lecture.
రాసేందుకు ఓకే అలాగే కొంచెం వెనక్కి పెట్టాలి ఒక పాయింట్ అట్టే ఉండాలి వెనక్కి కొంచెం వెనక్కి జరపండి ఆడోలు వస్తాయి రాత్రి ఇలా బుల్లి వాళ్ళందరూ పొట్టిగా వాళ్ళ వాడికి అందరిలే నాకేం పని వాడు చెప్పాలి ఏమవుతుంది వాడికి అసలు ఎవరిని దేవుడు నాకు చూడలేదు చూడండి ఆపేస్తుందా కాదు ఆ లైట్ ఆపమ్మా ఆ లైట్ ఆపి అది కూడా ఆపేస్తుంది అదే బ్యాగ్లో ఫోకస్ అవ్వట్లేదు స్క్రీన్ వెనకాల కానీ ఫోకస్ అవ్వట్లేదు స్క్రీన్ ఆ స్క్రీన్ బ్రైట్నెస్ కి ఫోకస్ అవ్వట్లేదు సరే
From Sri Lata ma'am, IQAC coordinator, head of the Department of Medical Surgical Nursing, Narayana College of Nursing, to enumerate the aims of the conference. Welcome ma'am.
Good morning to all. Good morning. I would like to welcome all the participants and dignitaries on the dais and off the dais. A special welcome to our chief guest, Dr. B. Valli ma'am, Registrar, APNMC. I'm welcoming ma'am. The Narayana College of Nursing and Society for Nursing Practice, in association with the BioLeagues, worldwide organized this 5th International Conference on Futuristic Nursing on 28, 29, 30 October 2022. So mainly this conference is emphasized the theme Futuristic Nursing, Navigation Beyond the Horizon. So in this year of 2020, everybody knows what is the 2020? 2020? COVID. So this year of 2020 that was designated to honor uplift our nursing field, where nurses have been in unimaginable circumstances around the world during COVID-19 pandemic. So the decade ahead will demand a stronger, more diversified nursing workplace that is prepared to provide innovative nursing care, which is a fundamental to ensure and develop the quality of nursing care. So a new, dimensional, digitalized, research-based, individualized, enhanced high-tech nursing care as the world is moving forward to artificial intelligence in all healthcare settings. So the Narayana College of Nursing and SFNP has planned to prepare nurses of India to be aware of future trends on future of nursing, physical to digital, pathway transforming future of nursing, and digital health technology, bioinformation techniques through various eminent speakers across the world. As all of you know, the Narayana group of institutions are pioneer and trendsetter for education, practice, and research. So this conference is a multidisciplinary program with broad participants, with members from around the world focused on learning about various phases of nursing and healthcare research. So distinguished nursing professionals include
inspiring and helping other nurses, compassion, empathy, care that makes a lasting difference in people's life. So this conference also first time in India taking about this future of nursing trends throughout the world. So we hope that Narayana College of Nursing and SFNP will continue to conduct either workshop or conference on telenursing, electronic documentation, and use of artificial intelligence in nursing and nanotechnology and nursing. So through this conference, the nursing profession will reach high tech to high touch. That is the highlight. High tech to high touch
By the year of 2000. Thank you. So once again, I'm thanking you for your active participation in this conference. Thank you. This is a small intro about this conference. Thank you all. Thank you very much, ma'am. Now, let me call upon Dr. B. Valli, ma'am, DDME, Nursing Registrar, Andhra Pradesh, and Nursing Midwifery Council, Vijayawada, a versatile personality with an extensive background in developing, implementing, and special workshops in clinical skill practices. She visited many international universities for nursing curriculum development and is an effective communicator with the excellent planning and organizing and negotiating strengths. She is an eminent administrator for building programs and organizing workshops and conferences, and she was the president for TNAI and SNA biennial conferences. I request many more research publications in national and international journals to be viewed and indexed journals, and she organized many community-oriented programs in and around her circle. I request Madam to speak about the theme for unveiling the conference theme. I welcome you, Madam.
Very warm good morning to all. We thank Almighty for making the day to be very colorful and very pleasant, very happy for all the people who have been here attending the conference and who are online attending the conference. The honorable dignitaries on the dais, Dr. Vijay Kumar Garu, the Registrar of Narayana Academy of Higher Education and Research at Nellore, Dr. S.P. Rao Garu, the Dean and Narayana Medical College, Nellore, Dr. Ajay Garu, the Principal of Narayana Dental College, Dr. Hariprasad Reddy Garu, the Medical Superintendent of Narayana Medical College, and the co-partner in organizing the conference, Mr. Siddharth Kumar Charger, Managing Director for Society for Nursing Practice from Chennai, India, and Dr. Indira, the Principal of Narayana Group of Nursing Institutions, Dr. Jayanti, Sri Narayana Group of Institutions, Professor Komalama, the Principal of Government College of Nursing, Nellore, and Special Observer from the APNMC, and my dear faculty of the Narayana and Sri Narayana, and all the nursing institution faculty who have been attending the conference, the resource persons from international who have been participating and making the conference a great success in. We wish them to have it, and all the researchers, the budding researchers and the scientific paper presenters who are very enthusiastically attending this conference, and my dear students, the nursing students and the media people, one and all, a warm good morning to all. I thank for the organizers making me to be a part of it. I stand here being a nurse. I am very proud, and everybody should say along with me, we are nurses. Say proudly. Yes, put your hand. We are nurses with full-fledged knowledge, heart, and skilled hand. All heads are together in a nurse. Yes. So nurses can do a lot. We feel no. Sometimes if you are not competent, nurse will be failing at the cost of life of the individual. So one should not assume that we know everything. The world that God created, the Almighty created the world. The creation is not stopped, it's going on. It's a cyclic phenomena and a systemic continuous phenomena. In this system, the birth and deaths have been going on, the life cycles for all the living objects and living organisms. In the same way, the materialistic changes are going on in the non-living. When you look into it, where we are at the edge of the changing world. What will happen? You may be within the bowl or you may be outside the bowl. When you are within the bowl, that means within the container in a edge, you are very safe. Where you know that you are inside, what kind of the atmosphere is available, what is there, what steps to be taken, what is your duties and responsibility. You are in the outside the bowl. You will be, yes, without hands, without knowledge, and you will be aimlessly waiting for something. And your time will be wasted and you will be non-responsible also. So these conferences will make nurses to be competent enough to work within their given purview and also to prepare them for the future. If you look into the olden days, I did not go to the past. We know the nurses means it's not an independent profession, it's an aiding job, that means helping the doctors or the healthcare providers in taking care of the patient. Caregivers, they are at the bedside with the passion, with the love, with the meeting all the needs of the patients at the bedside within the four walls of the hospital. But once the nursing has become with the modern Nightingale's activities and the other eminent leaders, they made the nursing to be an independent profession. It is like any other profession. It has growing body of knowledge. It has its own ethics and norms. It has all the principles. It is ever growing profession where it can cater the society. It is not a self-interest. What we are doing is for the society and we have the responsibilities in the society. So once it became a independent profession, yes, we need to sustain. The sustainability of the profession depends upon the theory, the body of knowledge. The knowledge that you have today will be very tiny knowledge, and tomorrow, just now we have been hearing and we are looking, the tele-nursing. Yes, where we are going, the informatics that are being applied in our nursing care. Within no time, once the patient comes to the OPD or in the casualty, the information from the patient will be reaching to the edge of the ward or to the corner of a operation theater, or sometimes it will be reaching to their home visiting auxiliary midwife or ASHA worker who is taking care of that family. The information goes such fast. So we want the nurses to be of that fastness, and this 5th international conference organized by Narayana group of nursing institutions with the collaboration of Society for Nursing Practice, we appreciate and we congratulate and wish you to have the very good luck. What are you going to learn in this conference? I just now told what a nurse is, what a nurse will be, what a nurse was. But this conference makes you to understand the various roles of the nurses. From the bedside, the nurse practitioner's role, the bedside practice service provider's role. She started teaching. She has entered into a nurse educator's role, teaching the patient, teaching the family members, teaching the surrounding people, the visitors who have been coming, the public that come in contact with them, how to prevent the disease, what steps to be taken, what vaccinations to be followed, what healthy habits to be followed. A good educator. And she used to manage the wards. nurse manager. She will be able to manage any situation that is very critical. How best she needs to take care. There is a triage system in the casualty. The nurses are also well versed with the system in the emergency situation, to whom they have to first attend, first, second, third, like that. In the triage, they will be categorizing them and providing the nursing care. Sometimes the nurses ratio and the patient's ratio is not on par with our norms that are available in our books or in our policies. If sometimes it is altered. So how to tackle the disaster situation or the emergency situation? We teach them and we make them to be readiness for the nurses. The nurses are the nursing leaders we are preparing to take care of the more profession for their welfare. When one is satisfied personally, professionally, automatically, when we are hungry, first what we will do? We will feed others or we will eat. First we drink the water. After drinking, if more water is there, we just look at our side. Do you want? Yes? So first the nursing professional leaders will make the nurses to be very satisfied and taking care of them. All the institutions, hospital authorities, organizations, we look forward in providing a satisfactory salaries for them, taking care of their working conditions and looking into their safety in the hospital, because the hospital hazards, hospital acquired infection, in a way will be touching the nursing and also the public and everyone that are been working in the hospital. So we look forward nurses to be a nursing leader, and the nurses' roles are being expanded towards looking at solving the problem. That small solving of a problem, identifying the cause for the problem, make them to look into the research field. The eminent, our nursing leader, Florence Nightingale, also started with a good researcher she was being. Yes, then later it is being transmitted throughout the world to every tiny nurses who have been sitting and taking care and registering themselves for the PhDs and the masters and going for the post PhD studies and all other things. We wish them to go there. Nurses, as a nurse researcher, they will come out with the findings, disseminate their information. We are having evidence-based practices. The nursing is also being moved towards the tele-nursing, and it also moved towards the advanced fields, community care, family health care. It is there already, but the specialization, some super specialties have been coming up to tackle and to take care of each and every corner of the consumer, either in the hospital healthcare setting or in the community, wherever it is. Nowadays, we are also looking, the nurses are being A4, they were being there, they are being there, holistic nursing. Newly, the palliative nursing concept is also coming. The palliative care, we used to think palliative care and hospice care, it is for the very critical patients who are being dying, who don't have any hope for that. That is the end stage care. Now the concept of the palliative care is also being moved and changed. The care needs to be started from the beginning at the time of the primary care that you are initiating, and the first your contact with them. They itself need to provide the supportive care and making the person to be relieved from the problems or the symptoms. So if you going on talk like that, it is been various things being added to the nurses' roles and nurses' responsibilities. Nurses are being there. So the futuristic nursing, the theme that was being selected for the conference is very odd, and we appreciate the organizers and especially the Indira Madam for taking this conference theme very opt for that. I think the conference theme, yes, everybody is very clear of the conference theme. Futuristic nursing. What else? Navigating beyond the horizon. Yes, we are beyond the horizon. We need to be prepared. Our nurses. Yes, what we have done, we say done today. That means today is enough. No, it is not enough. How we run at the back of earning money, earning name, earning people. At the same way, we need to be having a gist or a gene to learn, so that when our nurses in future, maybe we become very old, our generations will be going into the hands of the health providers now who are being there in their hands. So we need to prepare them to be very sound enough so that we will be preparing our nurses to take care of our young future generations. So on this platform, many developments related to the nursing functions, nursing fraternity, and all over the world, the developments in the nursing practice is also being discussed. And we also appreciate the support by the Society for Nursing Practice that came out from Dr. Siddharth Kumar Garu. Yes, we appreciate and we give a round of applause to both India Madam and Siddharth Kumar for organizing a wonderful international conference. To their credit, it was fit. Any conference when we attend, what we will get a simple certificate in hand. It should not be like that. For the nurses, the Andhra Pradesh Nursing Council will also give the credit. Why this credit? Credits are mandatory to renew your practice. When you are completing your nursing education, general nursing midwifery or the graduated BSc nursing or the master's nursing, you will be registered as a registered nurse and registered midwife. When you are being registered as a registered nurse practitioner, that registration needs to be renewed every 5 years. When you are renewing your registration, what we will do? Simply paying 200, 300 with a fine something. The money only takes matter, and you will be renewed to practice for next 5 years. But it is not like that. The future is very tough. It will be renewed only based on your learning and your paper presentation, your credits that you are going to gain. So these credits will help you to have a better practice and to secure your jobs and your licensing of practice in India and also internationally when you are being moving around. So I take a privilege for unveiling the conference theme, the futuristic nursing, navigating beyond the horizon. We see that the end of the second day tomorrow, we will be beyond our head, going with the heavy head, with the heavy foot and heavy experiences by cross-learning from each other. We thank the organizers once again for giving me this opportunity. All the best. I take opportunity to unveil the team and to go on. Thank you. Thank you, Vanessa.
Thank you very much, ma'am, for taking key part in the event and making it successful. Now let me welcome a strong personality with a sound mind and dedicated person, Dr. Vijay Kumar sir, Registrar, Narayana Academy of Higher Education and Research, to deliver the inaugural address.
అంతర్జాతీయ కాన్ఫరెన్స్ వచ్చేసిన డెలిగేట్స్, రిసోర్స్ పర్సన్స్, ఈ కాలేజ్ స్టూడెంట్స్, మీడియా మిత్రులు, దీనికి అంతటికీ మూల కారణమైన డీన్ ఇంద్ర గారు, అందరికీ నారాయణ వైద్య విద్యా సంస్థల తరఫున శుభాభినందనలు, నమస్కారం. ఈ 3 రోజుల అంతర్జాతీయ సదస్సు ఈ వచ్చినటువంటి డెలిగేట్స్ అందరికీ చాలా ఉపయోగకరంగా ఉంటుందని, దీనివల్ల వారి యొక్క స్కిల్స్ కానీ, ఆర్ట్ కానీ, నాలెడ్జ్ కానీ ఇంప్రూవ్ అవుతుందని, రాబోయే తరంలో నర్సింగ్ ఎలా ఉండబోతుందో దానికి సమాయత్తం చేస్తారని డిప్యూటీ డైరెక్టర్ గారు సవివరంగా వివరించారు. వారి సూచనల మేరకు ఈ 3 రోజుల కాన్ఫరెన్స్ లో అందరూ పార్టిసిపేట్ చేసి యాక్టివ్గా ఇక్కడ నుంచి టేక్ హోమ్ మెసేజ్ చాలా ఉపయుక్తంగా మీ యొక్క స్కిల్స్ ఇంప్రూవ్ చేసేదిగా, దీనివల్ల మానవాళికి నర్సింగ్ కేర్ ఎంతో అభివృద్ధి చెంది ఎంతో మందికి ఉపయోగపడే రకంగా ఉంటుందని ఆశిస్తున్నాం. ఈ నారాయణ నర్సింగ్ విద్యా సంస్థలు నారాయణ వైద్య విద్యా సంస్థల్లో అంతర్భాగం. వాటిల్లో నారాయణ మెడికల్ కాలేజీ, డెంటల్ కాలేజీ, కాలేజ్ ఆఫ్ ఫిజియోథెరపీ, పారామెడికల్ సైన్సెస్, నర్సింగ్ సైన్సెస్ తో పాటు మిగతా ఇన్స్టిట్యూషన్స్, ఇంజనీరింగ్ కాలేజీలు ఉన్నాయి, మనకు ఫార్మసీ కాలేజీలు, వీటన్నింటినీ కూడా నారాయణ అకాడమీ ఆఫ్ హైయర్ ఎడ్యుకేషన్ అనేటువంటి ఒక అంబ్రెల్లా కింద తీసుకొచ్చి మనం డీమ్డ్ యూనివర్సిటీ ఏర్పాటు చేసుకోబోతున్నాం రాబోయే కాలంలో. ప్రస్తుతానికి నారాయణ మెడికల్ కాలేజీలో 1250 మంది ఎంబీబీఎస్ విద్యార్థులు, సుమారు 360 మంది బ్రాంచ్ స్పెషాలిటీ పోస్ట్ గ్రాడ్యుయేట్స్, 54 మంది సూపర్ స్పెషాలిటీ, 12 మంది పిహెచ్డి స్కాలర్స్, కార్డియాక్ అనస్థీషియా పిడిసిసి 2, ఇలాగా డెంటల్ కాలేజీలో 500 మంది బీడిఎస్, 215 మంది పోస్ట్ గ్రాడ్యుయేట్ స్టూడెంట్స్ ఉన్నారు. మీ కాలేజ్ గురించి, నర్సింగ్ కాలేజెస్ గురించి ఆల్మోస్ట్ అన్ని, అంటే అండర్ గ్రాడ్యుయేట్, డిప్లొమా, పోస్ట్ గ్రాడ్యుయేట్, పిహెచ్డి కలిపి మోర్ దాన్ 1670 మంది ఉన్నారు స్టూడెంట్స్. ఫిజియోథెరపీ కాలేజీలో 250 మంది ఉన్నారు. అలాగా కాలేజ్ ఆఫ్ అలైడ్ హెల్త్ సైన్సెస్ లో బహుశా మన కాలేజీలో, మన అలైడ్ హెల్త్ సైన్సెస్ కాలేజీలో ఉన్నంత మంది బయట ఉండకపోవచ్చు. 206 మంది ఉన్నారు మన దగ్గర అలైడ్ హెల్త్ సైన్సెస్ పారామెడికల్ కోర్సెస్. మీకు ఈ ఫ్యూచరిస్టిక్ నర్సింగ్ లో మీరు ఎలాగా ఈ ఇక్కడ నారాయణ నర్సింగ్ కాలేజ్ స్టూడెంట్స్ ఉపయోగపడుతుందంటే, మన దగ్గర మీరు నేను చెప్పినట్టు నారాయణ మెడికల్ కాలేజీలో మీరు ఎలాగైతే అంతర్భాగం అని చెప్పానో, దీనికి సంబంధించినటువంటి ఇంటెన్షన్స్ ఏవైతే ఉన్నాయో, ఉద్దేశాలు ఏవైతే ఉన్నాయో అవి ఒకసారి చెప్తాను. దానివల్ల మీకు మీరు ఎలాగా బెస్ట్ నర్సెస్ అవుతారో ఫ్యూచరిస్టిక్ గా బియాండ్ ద హొరైజన్ మీకు అర్థం అవుతుంది. ఇక్కడ మనకు నారాయణ వైద్య విద్యా సంస్థల్లో క్లినికల్ అవుట్కమ్స్ ఇంప్రూవ్ చేయడానికి కొలాబరేటివ్ రీసెర్చ్, బోత్ ఇంట్రా అండ్ ఇంటర్ డిపార్ట్మెంటల్ అండ్ క్రాస్ ఫంక్షనల్, అలాగా పబ్లికేషన్స్, పీర్ రివ్యూడ్ కానివ్వండి, జర్నల్స్ లో నెంబర్ ఆఫ్ మోర్ పబ్లికేషన్స్ ఇంప్రూవ్ చేయడానికి, నేషనల్ ఇంటర్నేషనల్ కాన్ఫరెన్సెస్ లో పేపర్స్ ప్రజెంట్ చేయడానికి, ఇలాగా ఈ కాన్ఫరెన్స్ లాంటి వేరియస్ కాన్ఫరెన్సెస్ లో, తర్వాత ఇంటలెక్చువల్ ప్రాపర్టీ రైట్స్ జనరేట్ చేసి, ఇప్పుడే మన సిద్ధార్థ ఇప్పుడు మాట్లాడాము. సో ఇంటలెక్చువల్ ప్రాపర్టీ రైట్స్ చేసి వాటిని కూడా మీరు నర్సింగ్ ఆర్ట్ లో మీరు వాడేటువంటి వేరియస్ గ్యాడ్జెట్స్ లో వాటిని మీరు కమర్షియలైజ్ కూడా చేయాలని, తర్వాత రిసెర్చ్ సొసైటల్ ఇంపాక్ట్ ఉండేటట్టుగా మీరు చేయబోయేటువంటి రీసెర్చ్, దాని అవుట్కమ్స్ అన్ని కూడా సొసైటీ ఇంపాక్ట్ గా ఉంటుందని, అలాగా ఒక బ్రాండ్ వాల్యూ, క్రియేషన్ ఆఫ్ డిస్ట్రిక్ట్ బ్రాండ్ వాల్యూ అండ్ బ్రాండ్ పొజిషనింగ్ ఆఫ్ నారాయణ నర్సింగ్ ఇన్స్టిట్యూషన్స్, ఇలాగా వీటన్నిటికీ మీకు కావాల్సినటువంటి సహాయ సదుపాయ సహకారాలు కూడా ఈ క్యాంపస్ లో నారాయణ వైద్య విద్యా సంస్థలో ఉన్నాయి. కాబట్టి మీరందరూ కూడా ఈ మన న్యాక్ అక్రిడిటేషన్ అయిన తర్వాత మీ అసెసర్స్ తో మాట్లాడితే చాలా గొప్పగా చెప్పారు. ప్రధానంగా ఇన్నోవేషన్స్, పర్టికులర్గా టీచింగ్ లెర్నింగ్ ఎవాల్యుయేషన్ మెథడ్స్ లో కానీ, మీరు ఎగ్జామినేషన్ సిస్టమ్స్ లో కానీ, రిజల్ట్స్ కానీ, తర్వాత స్టూడెంట్స్ కు క్లినికల్ నాలెడ్జ్ లో కానీ, వీటన్నింటిలో వాళ్ళు చాలా సంతృప్తి వ్యక్తం చేశారు. కాబట్టి అలాగే రాబోయే రోజుల్లో కూడా ఇంకా ఎక్కువ మంది స్టూడెంట్స్ కు ఈ యొక్క ఉన్నతమైనటువంటి విద్య బోధన స్కిల్స్ డెవలప్మెంట్ చేసి, మనం నారాయణ నర్సింగ్ కాలేజ్ నుంచి బయటకు వచ్చినటువంటి ప్రతి గ్రాడ్యుయేట్, పోస్ట్ గ్రాడ్యుయేట్, రీసెర్చ్ స్కాలర్కు అంతర్జాతీయ గుర్తింపు లభిస్తుందని, అలాగా చేసే దానికి దోహదపడేదానికి ఇందిర గారికి, వారి సహాయ బృందానికి అందరికీ బెస్ట్ విషెస్ చెప్తూ థ్యాంక్ యూ వెరీ మచ్. గాడ్ బ్లెస్ యూ.
Thank you very much, sir, for your valuable words. It is my turn to extend a gracious and inclusive welcome to determinable person in accomplishing the success, Dr. B. Ajay Reginal, sir, Principal, Narayana Dental College and Hospital, for the inaugural address. Welcome, sir.
you, madam, and dignitaries on the dais, and dear friends. Let me first congratulate the nursing colleges for organizing consecutively the 5th International Nursing Conference in 2022. For the last 5 years, I've been witnessing the organization of the conference. I must tell that this is a grand success by participating from various countries. In this year also, there are many people who are participating in this conference. And last 2 years, the nursing profession did the greatest job, and I must put on record my sincere gratitude to all the nurses who have served the COVID patients for the last 2 years. Even medical professionals were so scared to enter into the ward. The nursing profession took greatest care and served the COVID affected individuals. I am very thankful to the nursing profession. Coming back to the theme of the conference, as the futuristic nursing, there are 2 things which you should remember. One is the technology. The technology has invaded the health profession, especially the medical profession, and nursing profession is not behind. There are various technological innovations which have come up in the nursing profession, like mother and child tracking and various others, which are being routinely used in various states, including Andhra Pradesh. So you must be aware of the various technological innovations that have come up in the nursing profession, and you must be able to embrace this technology into your profession. Secondly, the traditional nursing teaching moved away from midwifery to the futuristic nursing. Dr. Valli has already described some of the futuristic nursing avenues that have come up, including the palliative care. Previously, we used to be obsessed with the healthcare system. Expanded to such an extent that each and every village now has got health functionary. Now, the profession has to think of the competency instead of the expansion. The competencies are the abilities to perform the task to the highest quality. Quality is the driving force. Remember, competency is the core to which we should learn the nursing profession. As you can see, ANM has now become the nurse practitioner. You have to see how the nursing profession is evolving from midwifery to the nurse practitioner. Majority of the duties which were previously ascribed to the medical professionals, so-called doctors, have now been taken over by nurses. Like, for instance, diagnosing common diseases, treating them has become the part of nurses and nurse practitioners. Though India is lagging behind in introduction of the nurses practitioners, there are many countries where nurse practitioners have been put into efficient use. And as you are graduating from nursing, as nursing graduates, and you have to be in this profession for another 50 years. So in another 10 years, you may have to take over most of the jobs of doctors and become nurse practitioners. And for that, you have to adopt the core competency. And to attain this competency, Narayana Medical College is helping you in providing the facilities to learn super specialty care as well as an innovation center. There is an innovation center which has been recognized by Ministry of Education, which is in existence at Narayana Medical College. So those who are interested to innovate as Dr. Vijay Kumar sir is talking about innovation and the intellectual property rights. If you want to innovate, we are here to help you so that you may be able to develop a product which is of commercial value. So there is an innovation center which is in existence. Besides that, we are the only center recognized to conduct clinical trials. Clinical trials doesn't mean only giving medicine and then revenue. Even simple counseling is also a clinical trial. So clinical trials, the clinical trial center is recognized by the Indian Council of Medical Research, and those who are interested, they can conduct multi-centric clinical trials as a part of the center. So with these facilities, we are also trying to introduce new courses so that you will be at a higher level compared to any other nursing student graduating from any other nursing college. One of the courses which we are introducing for medical students is aerospace medicine. A certificate course in aerospace medicine, a certificate course in sports medicine are being introduced in the coming few months. So similarly, such specialty courses which can be used as enrichment courses for nursing can be started so that the Narayana Nursing College students can be at higher level compared to the other nursing colleges. I congratulate once again the nursing college, both nursing colleges, for organization of this conference, and I hope the conference will be a great success. Thank you very much.
Thank you very much, sir, for your valuable insight. Now, let me extend my welcome to Dr. Ajay Reginald, sir, Principal, Narayana Dental College and Hospital, for the congratulations.
A very good afternoon to one and all. I would like to extend the greetings of Narayana College, the faculty and the students, to all the delegates who have gathered out here. And I also take this opportunity to thank, to congratulate and appreciate all the faculty and the team at Narayana College of Nursing that has made this day possible. So I would all like to wish all the delegates a happy learning experience. And when you leave us, you leave us.
Sir, now let me welcome the person who is one of the important persons for the conference, Mr. Siddharth Kumar Chatter, Managing Director, Society of Nursing Practice, BioLeagues, for addressing the gathering.
Good afternoon, everyone. To the distinguished guests, eminent scholars, delegates, nurses, committee members, participants, and students, on behalf of Society for Nursing Participants, it is great pleasure indeed for me to welcome all the delegates, speakers, session chairs, committee members, nurses, young researchers, and students who joined here to share their knowledge and vast experience for this impressive and prestigious 5th International Conference on Futuristic Nursing, organized by Narayana College of Nursing and Society for Nursing Practice, with the theme of Futuristic Nursing, Navigation Beyond the Horizon. I would like to thank you for giving me this opportunity to share with you my perspective about this conference. Despite significant advance in nursing research throughout the globe, the knowledge to practice gap still exists, where many of the nurses are unaware of some of the knowledge related to nursing research and the effect to translation science. Many of our nurses struggling with determining their objective of nursing research, the best methodology design and approaches, and how to publish the result for the nursing studies intended audience. I believe that by offering a forum for scientific interaction, the conference theme could help the close that knowledge to practice gap. The most recent research on different nursing specialists and a subspecialty will be presented by the prestigious panel of international specialists in nursing research. Nursing is very difficult but really rewarding profession that offer the ability to have significant impact on the lives of many people. No time has brought this to life more vividly than during the COVID-19 pandemic. Nurses are engaged in the frontline helping patients and doctors during a time when the entire world is gripped by dread and uncertainty. With many places being placed on lockdown, the nurses field will never be replaced by technology, since it calls the fundamental human quality of paying attention, empathy, and care. But because to technology advancement, nurses no longer have to perform as many boring and repetitive activities, which is especially useful during the pandemic when time is of essence. In the not too distant future, nurses' regular work leaves many incorporate this too will even as frequently. Robotics cutting back on monotonous tasks, remote communication reaching isolated communities, drawing blood with technology, explaining complex medical language with 3D printing, portable diagnostics for increasing access to care, artificial intelligence accessing risk and eliminating alarm fatigue, virtual reality for education, new tech for better medication management. New clinical healthcare technology is existing and transformative with innovation launching every day that impact the industry. This can present challenge to nurses who are tasked with learning about this new technology, implementing into their work life, not to mention how this can impact their career advancement. With this advancement of new technology in the healthcare industry, it's crucial for nurses to keep abreast of the innovation and elevation their capability to match what both patient and the industries require for exceptional care. Education is a key to navigate these new waters. Society for Nursing Practice plays a vital role in the providing nursing education, data collection and analysis, COVID-19 pandemic, preventive healthcare, patient knowledge, continuing education, online nursing education, telehealth are the 7 emerging trends of nursing education and the emerging technologies. Change the future of nursing, robots, and that assist doctors in doing medical duties. AI algorithms that more effectively and reliably sort data to deliver better diagnosis and technology that makes nurses themselves feel more at ease in the work are few numerous applications of AI and robotics. Telehealth services, AI and machine learning, virtual augmented mixed reality, remote patient monitoring, patient wearable medical devices, patient portal, medical devices, and robotics and the nursing technology trends to be watched in 2023. The conference promises to be exciting with a range of presentations, including topics related to medical surgery in nursing, public health nursing, gynecologic nursing, pediatric nursing, mental health nursing, oncology nursing, cardiac nursing, nursing and healthcare, nursing education, nursing administration, and occupational health nursing. Lastly, there is a presentation that covers of lifespan and from pediatric to obstetric to adult health nursing, all covering information that is new and relevant to nursing and healthcare. We want to take this opportunity to encourage your attendance and participation in the unique conference in order to take advantage of the more recently scientific discovery and milestone in the field of nursing. We believe this more you participate, the more you take away from this conference, and we would encourage your active participation by taking advantage and opportunity to interact with internationally renowned nursing leaders. You will have opportunity to meet established network with nursing professionals from various parts of the country. The conference will now provide you the platform to share your views, experience with other exchange of ideas will definitely enrich overall fresh perspective and nurses. SFNP is a professional organization dedicated to the advancement of nursing science and healthcare. SFNP provides platform for nurses for all over across the world to exchange ideas and innovation in the area of nursing science and healthcare. By bringing nurses together, SFNP hopes promote intellectual growth and offer chances for networking and collaboration. In the field of international conferences, workshops, webinars, seminars, publications, and student and professional membership, we are providing from our side. While concluding, I would like to welcome all the conference participants who are awaiting to share their knowledge and experience and to explore better way of education, our future leader. I take this opportunity to welcome each one, express their gratitude in your agreeing to participate in this conference. Thank you.
Thank you very much, sir. Now let us call upon all the dignitaries for the release of sovereign.
అరవింద్ చెయ్యి దూరంగా నేసుకో. రాకే రాకే ఫాస్ట్గా లైట్ అరవింద్ లైట్ మేడం వస్తుంది దగ్గరికి కాదు వెనక్కి పెట్టి మేడం వస్తాయి తిప్పు అంతే. వెనకేసుకొచ్చారు.
I request all the students to give a great applause.
ఆ నుండి కాదరకండి రమ్మను బోర్డులు పెడతాను.
Now let us continue with the felicitation.
ఓకే లైట్ ని కొంచెం అటు తిప్పాలి, ఒక పాయింట్ తిప్పాలి అంతే. ఇదో వెనక పెట్టు. రాకి కొంచెం అటు తిప్పు, ఒక్క పాయింట్ తిప్పు అంతే. రైట్. నువ్వు ఆడపిల్లగా నువ్వు గమనించలేదు ఎక్కువ వాళ్ళకి మలయాళం అంట మలయాళం అవును దాని తప్పే ఉంది
We are very happy and pleased to felicitate you, Madam, Dr. B. Lali ma'am.
అరవింద్ వెనకనే తీసుకో బాబు అరవింద్ అరవింద్
grace and blessing shower known as for completing this inaugural function. It is with great pride that we are hosting this 50th International Conference, and we thank our management for having support us as always. We owe special gratitude to Mr. K. Puni, President, Narayana Group of Education Institution, Dr. Sindhura Narayana, Managing Director, Narayana Group of Education Institution, in their absence. We express our heartfelt gratitude to Dr. Vani, DDME, Nursing Registrar, Andhra Pradesh Nursing Council, Vijayawada, and Dr. S. Annie Grace Kalendri, Registrar, Tamil Nadu Nursing Council, Chennai, Mrs. Kamala Ma'am, Observer APMC, for accepting our invitation and gracing the occasion. We are very grateful to our Principal Dr. Indra S. Narayana College of Nursing and Professor B. Jenny, Principal Narayana Nursing College, for their encouragement and support. We take this opportunity to thank all the dignitaries, Dr. S. Vijaykumar, Registrar, Narayana Academy of Higher Education and Research, Dr. S. P. Rao, Dean, Narayana Medical College, Dr. B. Ajay Regina, Principal, Narayana Dental College and Hospital, Dr. Shiv Kumar, Academic Dean, Narayana Dental College and Hospital, Dr. Rama Rao, Operation Head, Narayana Medical Institution, and all the delegates who have gathered here this day to make this event successful. We thank all the students and faculty who have tirelessly worked to make this event possible. I also extend my sincere gratitude to all the heads of the department for extending their unconditional support. We thank the team of Society for Nursing Practice for the support they have provided us with. Our sincere gratitude to all the support staff who have worked relentlessly behind the scenes. We thank the press people for covering the event and their contribution. Thank you all.
Thank you very much, ma'am. Now we finish the inaugural session, and the continuation of the scientific session will be continued shortly. And the inaugural session will be finished with the national anthem. I request all the gallery to sit for the national anthem.
भारत भाग्य विधाता पंजाब सिंधु गुजरात मराठा द्राविड उत्कल गंगा विंध्य हिमाचल यमुना गंगा उज्जवल जलसि तरंगा तव शुभ नामे जागे तव शुभ आशीष मागे गावे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
I request all the students to please sit down.
అన్నదాకా చేస్తున్నారు. కాదు సీల్ ఆల్సో నాట్ సీల్ ప్రెసెంటింగ్ బ్యాటరీ ఓకే నాట్ సెట్ బ్రో సెట్ చేసిందండి అంటే వదులుకుంటారు సార్ వీటిలో పెట్టేదా వీటిలో పెట్టేదా వీటిలో పెడతాను సీట్ ప్రజెంటేషన్ వీటిలో పెడతాను క్యాప్చర్ చేసుకోండి. అది ఇప్పుడు వచ్చింది మళ్ళీ ప్రాబ్లం ఫస్ట్ టైం రాదా బట్టలే ప్రాబ్లం కొంచెం అదే ఆగింది మళ్ళీ ఆఫ్ చేసి ఆన్ చేస్తే ఓకే లాస్ట్లో అంటే బ్రేక్ అని చెప్పలే సార్ సర్వీస్ చేయించాను చీల్డ్ ఇచ్చేటప్పుడు ఇది అయిపోయింది అతను పోలా నాకా రికార్డింగ్ ఉంది నీకు కావాలంటే రీప్లే చేస్తాను నువ్వు పెట్టుకో అన్న పర్లేదులే అన్న మా తప్పు కాదు అది ఈ బ్యాటరీ పోయింది వాడు ఇంకో బ్యాటరీ వేస్తే అది సెట్ అవ్వాలి మళ్ళీ ఇంకో బ్యాటరీ వేస్తే అది సెట్ అయింది వాళ్ళు టీమ్ అంటున్నా ఇలాంటివన్నీ వాళ్ళు చేస్తుంటారు చెన్నైలో కంపెనీ తరఫున వాళ్ళు మొత్తం డెకరేషన్ సౌండ్ సిస్టమ్ అన్ని వాళ్ళదే ఉంటారు కాకపోతే వాళ్ళు అక్కడి నుంచి తెచ్చుకోలేక ఇక్కడ మాట్లాడుతున్నారు. పది నిమిషాలకి ఎందుకు బయటకు వాటర్ చిక్కిది బయటకి
organizing
బ్రేక్ ఇచ్చారు 10 నిమిషాలు అన్నా. 20 వేసి పెట్టున్నారు ఫుడ్ అంతా. బాబు అన్న ఫోన్ చేశాడు లక్ష్మణ్ అన్న. బ్రేక్ కానిస్తే అందరూ బాగుంది అన్నాడు. బ్రేక్ అయిపోతే అక్కడ ఉండే ఆయన బొమ్మన్నాడు. తినే కొంచెం ఎక్కడ ఏం చేస్తున్నాడు ఇలా కాలేజీ వెళ్ళడానికి అన్నాడు.
Now I request all the students to take your seats. I request all the students to settle down, please. Back seats, please sit down. Now we are going to start with the scientific presentation. I am glad to invite Dr. Carol Gertz Mays, Madam, nurse scientist and clinical educator, institution board coordinator, Woodland Regional Medical College, USA. She is a very operative nurse and an operating nurse, clinical educator, and a facility institutional review board coordinator with 30 years of experience, including working as a scrub nurse and manager, clinical educator, and assisting in sterile processing, the ambulatory care units, and also she continued many classes for the post-anesthetic care unit, and she did nursing training programs for virtual and also in reality. And she is a dynamic educator in organizing a wide training for facility and including teaching dysarthria classes and preceptor courses. She has facilitated many quality improvement projects and developed a new perioperative nurse training. And recently she presented her colleagues and her study findings in the ARAM 2022 conference, and she published many international and national publications, and she recently published a grounded theory in intraoperative team member decision making. And I'm very glad to have Carol Madam as
Good afternoon to all. It's my immense pleasure to invite Dr. Caroli ma'am for presenting the topic on new era of nursing education. Thank you.
over to you, ma'am.
All right. I am here.
Please unmute your mic and speak, madam.
Can you hear me? Can you hear me? All right, hang on. I am going to try something. Oh, there we go. Awesome. So can I share my slides, please?
Everyone, we can't hear you now.
You can't hear me?
Hello? Hello?
All right, can you hear me?
Yes, ma'am, we can hear you.
Okay, now can I share my slides?
Sure, ma'am, you can hear.
Hello?
Okay.
Laura?
All right, I am trying to share my slides, but nothing is happening. All right, so. All right, well, everybody can hear me?
Yes, ma'am, yes, yes.
And is anybody able to advance the slides for me? All right, well, I am not hearing anything about being able to advance my slides. So what I'm going to do is, I guess I'm going to do it without the slides, which is too bad, but that's okay.
మధ్యలో బ్రేక్ ఇస్తారు 2 గంటలకు అని ఇస్తారు
Can you see the slides?
That's okay. Yes, ma'am. We can see.
You can see.
Yes.
Can you see the slides or just me? All right, well, I'm going to go ahead and get started. I'm not sure what you can see. So thank you for this honor of being able to present to everyone. I am greatly honored to be presenting from the US. and I am presenting on the new era of nursing education. So like you said, I'm from Rutland, Vermont, and I've got no conflicts of interest. And at the end of this presentation, my hope is that you'll be able to discuss one action that you can take to transform nursing education. So let's go ahead and begin. And if you can see this, great. If you can't, I'm sad. But a long time ago in a world far, far away, on the planet of Hygeia, nurses faced events requiring a new nursing paradigm. And with that being said, all right, something's going on here. Something's not working. That's okay. All right. So, a new era in nursing. What we're going to start off with is we're going to talk about 3 different focuses for nursing. Oh, there we go. Oh, I see. Okay, cool. Let's see. And is, all right. Let me see. I think, so you can see the slides now.
Yes, ma'am, we can see you. And the slides.
Awesome. Awesome. Thank you so much. I'm going to go back.
Great job. Go ahead, ma'am.
All right. So I'll continue on. So reintroduction. And Susan. Okay. So here we go. This is how I wanted to introduce it. A long time ago, in a world far, far away on the planet of Hygeia, nurses faced events requiring a new nursing education paradigm. And on this planet, as you can tell, the name Hygeia references the Greek goddess of healthcare. And this planet was inhabited by a tremendous number of nurses. Also, this planet is unique in that it has 3 moons. And just like any world, the rising and setting, I shouldn't have said moon if they're suns, the rising and setting of the suns actually influence the evolution and the impact of the socioeconomics and the environment of the world. So on this planet, these moons influence 3 areas within this nursing population. They influence the development and evolution of the nursing profession. It influences the education path, and it also influences the technology. So with that being said, we're going to talk about the effects of each of these moons, which surprisingly reflects what is going on in our world. So let's talk about first the nursing profession and the evolution of the nursing profession. Overall, nursing started many, many years ago in ancient times where individuals performed nursing tasks under the auspices of different individuals. They were told, you need to do this and this to take care of this group of people. And many times they were guided by the religious order of the time. And at that times, especially with the Greeks and the Romans, it was under the gods associated with them at the time. But as we all know, and because we are nurses, we know nurses are very independent and very creative thinkers. So eventually, they started taking their own ideas and moving themselves along in their profession because they saw the need outside of what they were being told to do. And so the nursing profession began to evolve. You can see they started working outside the walls of the religious organizations to take care of the poor and impoverished outside those walls. So going beyond those expectations. Again, with the development of the socioeconomic times, they also saw the need for developing new career paths and new groups of people that need to be taken care of. And this was mentioned in the introduction of this conference. Dorothea Dix in the early 1800s really focused in on advocating for treating the mentally ill. Clara Barton actually went to Europe from the United States and she learned about the Red Cross and she brought it back to the United States. And actually during the Civil War, that's when the American Red Cross was implemented to take care of the wounded during that war. So again, nurses are very proactive and creative and ambitious, seeing what needs to be done. You can see with all these references on the timeline, how the nursing profession has evolved based on what was going on at the time. Again, with wars, actually with the ability of the nurses to advocate for themselves and show how important they were, and also how much knowledge we have and our importance. They were brought in to help take care of the wounded during the Spanish-American War because they were educated. And the armed services actually started developed a corps for nurses because they recognized the value that nurses brought to taking care of the wounded. Also, nurses identified there's other populations that we could positively impact. So nursing developed school nursing, another avenue besides the traditional care of the sick and dying. Also, throughout the time, there were different events where nurses a lot of times were taking care of populations in their homes. And this was held in high esteem because they were working with the families. But during the Great Depression, the families lost money, they lost their jobs there, and then they looked to go back to working in the hospital setting, the acute care, but still continued even throughout that time to look and evolve and see what other pathways we can take to take care of the population. And as you can see, we developed frontier nursing, which is in Kentucky, went out on horseback to take care of those individuals who couldn't come in and get the care that they needed. And that still continues to this day, developing nurse practitioner programs, developing hospice programs. And then in the 70s, starting to get into research, recognizing that we can help promote the health and well-being by understanding what healthcare practices can be preventative medicine, basically. That continues on. Nursing research has just been exploding. But then also, again, the impact of nursing and the importance and the value continues to rise. And so nurses are going into different positions, even beyond patient care, so that they can run hospital organizations. We are becoming advocates and consultants to leaders within the government, within the military, which is incredible. We have a big influence on healthcare. So that's the trajectory, lots of different avenues for nurses to help influence the population. But now we need to take a look at the practice settings. Over the years, it has dramatically changed. Many people think of nurses being in the acute care setting, but what you can see here is that even over the past few years, the number of nurses going into different avenues has definitely increased. On the far right-hand side of this graph, you can see nurses have definitely increased focus on being involved in policy and regulations within the government, and also going into other avenues of nursing outside of the traditional realms, such as, like I've mentioned, research, being consultants, but also developing their own companies, being innovators, but still many times with the focus of preventative medicine, taking care of each other. And this, again, the specialties you can see that have changed over the past few years. You've got your traditional acute care, but you can see it's falling, the traditional. Nurses are branching off into all these different avenues. And that's really important to be aware of, these opportunities, because that then links back to nursing education. We're going to go back again and look at the evolution of nursing education briefly. But what you can see is that nursing education has evolved over time. Like I alluded to, initially, it was basically, here's what you need to do to take care of the sick individual. Then it became more of an apprenticeship. Then, with the advent of recognizing we need to share information, individuals started looking for more formalized training. In fact, most of us are very aware of Florence Nightingale. She actually went to Germany to the St. Thomas Hospital. Well, that's where she worked in England, but she went to Germany to learn for 3 months about their nursing program, brought that back to England at St. Thomas's Hospital and set up her own school of nursing. And then that led to other nurses and organizations developing their own schools of nursing. But what is notable during this time is that this was primarily an apprenticeship program, still under the umbrella of the hospitals, where the focus was on first taking care of the patient. Let's do that. And if you learn the theory behind it next, then okay, that's what you get. That wasn't the main focus. But again, nurses are creative. We are very proactive. We're driven. We wanted to get more of the theory to understand why we are doing what we were doing and then grow beyond there. So then nursing evolved away from the hospitals into the university settings in the early 1900s. And then nursing started to become regulated. We developed licensure. And with all of this coming together, there was a need to develop one body of knowledge so that everybody knew that nurses, everybody had that same information. We need to all come from a baseline of information. So then this started the movement where you have your basic core content for all nurses, specifically registered nurses, that they must learn. But think back to the evolution of the pathways of nursing. That's interesting. You have diploma nurses, baccalaureate nurses, all these programs were exploding. You have master's level nursing that's exploding. And the first time that they go into the setting because they just graduated and earned their nursing license, we all take, even to this day, the same nursing exam, but we've got different levels of education, different focuses. When you get into the baccalaureate program, there's focus on leadership and community care. When you get into the master's, it's definitely leadership and starting to lean more towards research, all of that, but we're all getting the same content and we're being tested on that. But there's all these other avenues where after graduation we get into, but the education doesn't stop. But the formal nursing education, it cuts off at that baseline. And from there, what we need to do is we need to figure out a way to get these nurses the education that they need to go directly into these specialty areas so that they can take care of all of these different populations and meet the need. In the last article that I saw about a month ago, by 2030, there will be a need of 30 million nurses worldwide. And we all know what the nursing shortage is currently. So we've got to figure out how to make that happen. And as you can see, nurses have evolved in terms of the groups that are becoming nurses. We're becoming more diverse, which is really good because the globe is shrinking. We've got to be able to take care of all populations. Also, what is sad is that there are more and more nurses or individuals wanting to get into nursing. But look at this graph. BSN applicants are being turned away in thousands. And that's a problem because we need, again, all of these nurses, but if we can't educate the numbers that we need, how are we going to meet the demand? So part of the issue with this turning nurses away from school is the fact that nursing schools don't have all of the instructors that they need. You can see here, nursing schools are reporting vacancies, but they're also reporting that while some nursing schools don't officially have vacancies, they report the need to have more faculty in order to handle the number of nursing students. So they're getting inundated with a bunch of students, but how are they going to manage all those students when the ratios are off? So let's move on to technology. Big focus of this conference, which is great. So I didn't do a traditional timeline here, but this gives you an idea of how technology has evolved. And we can talk about it, how it's been incorporated into nursing education. You can see we started off with chalkboards, individual chalkboards, and these old-fashioned projectors. They were called magic lanterns. Chalkboards, the initial education, small groups, but the more technology developed, the greater numbers of students that could be taught. So chalkboard, one individual. Projectors, bigger classroom. Then you get the advent of, let's say, typewriters and books. You can reach more individuals, get that same content to everybody. However, one of the downfalls with books is that it takes so long to publish. So by the time they come out, a lot of times these days, with the advent of technology, the content is pretty old. Some of it is really good and still valuable, but others, it's out of date, so it's useless. But there's other technology that can help us train these new nurses. In the early 1900s, we started having more, or 1990s, more simulation with mannequins. And if you think about that, when you have a large volume of students that you're trying to train, you have a limited number of healthcare settings in which you can get them into, because they have to have the space, but they don't have the safe space. So how do you train them on some of this direct patient care? We have to leverage the technology that has developed. So the mannequin's not the best replacement for a live patient, but it works. You can make it work, and it gets them introduced into different situations that they may not have been able to be involved in. And then in the 2000s, with the explosion of smartphones, iPads, all of this really gives us the ability to, again, reach more students. We're doing virtual conferences now. I'm speaking to you from an office in Vermont in the United States. You guys are overseas. This is incredible that we can do this now. Now we can train nurses, bigger numbers, virtually. And it also brings the new information to the student much faster. There is a new improvement in care. People click on the computer, they have it immediately. They don't have to wait for a book to be published. So instant access. And then with technology, with virtual reality and simulation, this has gotten so good. It puts you in this space talking to an avatar that has artificial intelligence that can respond to the nursing student just as a real patient can. Not exactly, it's not perfect, but it really does help give them that experience that they may not get in school. Thinking back with the pandemic, especially early on, organizations shut down, they wouldn't allow students in. But by leveraging this type of virtual reality technology, they were still able to get somewhat of this clinical experience. Again, it doesn't take the place of the direct patient care, but it really helps them. So if you don't have the opportunity to be exposed to something, at least you get introduced to it. And think about all these different pathways of nursing that we have now, not just the traditional medical, surgical, bedside care nurse. We have nursing informatics. We have operating room nursing. We have infusion therapy. We have home health care. We have palliative care. All of these different venues. How do you get exposed to that in nursing school? You don't. We still have that generalist education, but maybe by leveraging all of this technology, we can incorporate some different classes or portions of classes to introduce the nurses to some of these core basic skills and knowledge about these different avenues, so that when you graduate from nursing school with that generalist information, you have a better idea of the path that you want to take, and you actually have some skills, so that once you get out of school, you don't have this big hill to climb for additional training, which is currently happening. All right. So as you probably have noticed in my introduction, I love Star Wars because it's all about positivity. It's about the future. It's about what can be done. And as Yoda says, we have to pass on what we've learned. We have to try all of these different opportunities. If we fail, but that's okay. But we have to do it because we will learn from it. So I'm going to give you a story of a transformation at the organization at which I work. In the operating room, many times nursing schools, again, having a generalist focus to pass that Board of Nursing test for all these different levels of nurses, the students don't get exposed to this avenue or path of nursing. And in the OR operating room, it's hard to find new staff who are interested or even knowledgeable about operating room nursing. So how do we get them in there? How do we do that? Well, what we've done over the past few years is we've developed an operating room simulation lab where we train brand new nurses, but they still, when they hired on initially, they weren't truly aware of what it took to be an operating room nurse. They just thought it sounded cool and fun based on what they saw on social media or on television. So what we ended up doing last year is we partnered with a local school and we proposed developing an enhanced operating room experience during their clinical practice during one of their senior classes, which focused on adult medical surgical patients. And what we did is we told students that for those of you who are interested, we want you to apply. We will take 2 students, and we had them interview. We had them write why they wanted to do this. And we chose 2 students, and the expectation was they had to do online modules, so new technology virtually, where they learned the core theories, basic theory of operating room nurses before they came to me in the operating room simulation lab, where we spent 2 full days together. They've connected the theory to skills because they practiced the core skills of being the scrub nurse and of being the circulating nurse. And then they went into the operating room. We paired each of these students with an operating room nurse so that they each got actual experience, a full day of experience as a scrub nurse. So they got to do it. They put the gown, the gloves on, they passed instruments, they got to touch guts, the body. And they also got paired with a circulator. So they were doing the patient interviews. They were helping position. They were helping to do the instrument counts. They got that experience. and they understood what it took, to the best of our abilities, what it took to be an operating room nurse. At the end of their nursing school, they applied for two of our 4 open positions, and they are flying through our training program. And that would never have happened if we hadn't leveraged the technology, hadn't thought outside of the box. And the education after the initial onboarding or the initial training never stops. We always have to continue the education. Graduation from a nursing program is just the first step. Then you have the onboarding or the initial training in that clinical setting. But we eased it by providing an introductory pathway. But then you have the continuing education. And in order to give everybody the continuing education that they need, we still have to leverage all the new technology. And in this photo here, what you can see is one of our newest nurses using virtual reality to practice a skill that we've never had to deal with in the operating room. She's practicing putting out a fire. We can't simulate that. We can't burn something in the OR. So she does it this way. And all of our team members do this twice a year so that they get that experience. And it works really well. The staff enjoy it. And so now we continue to build on these opportunities. And it's just going to continue to grow. The way that we can develop and change and influence nursing education from the traditional nursing school pathway, it's going to change. We're going to help modify those paths through to the continuing education in the clinical setting. So as my friend Yoda says, try not, do or do not. There is no try. We just have to do it. That's what we have to do. We have to be forceful. We are creative. We're very innovative. So with that being said, to meet the needs of our world, because remember, we have a gap in the number of nurses. We need 30 million nurses by 2030. We have to transform nursing education by being who we are. We are brave, we are fearless, we are bold, and we are innovative. That's who we are. So I challenge all of you to do the same. So thank you, and I appreciate your attention. And I apologize for the technical difficulties, but I'm honored to be speaking with you. Thank you. I didn't know if anybody had any questions. Well, thank you, and I will stop sharing. And apparently, well, thank you, and I will stop sharing.
Madam, okay, ma'am.
This is one of the organizing people calling from India. Can you hear me now, Dr. Carol? Yeah. Anyway, thanks on behalf of Futuristic and SFNP, I thank you wholeheartedly for giving us a wonderful presentation on newer trends in nursing education. Because in your message itself, it was clearly given that where we have to change, that is where the future is going to be like, shortage of nurses, and where we have to improve and where we have to equip ourselves to match or to face the shortages. Once again, on behalf of our conference, we thank you wholeheartedly. Thank you very much.
Now we are moving to the next section. I may now request Dr. Secretary Ms. Riya Jalal, Assistant Professor, College of Applied Medical Sciences, University of Al Ashar, Kingdom of Saudi Arabia, a therapy teacher and a professor in the profession of nursing. She teaches for BSc nursing, post BSc and NSS students, and more than 25 years of experience, and in a top-ranked university, and experience with handling involving teaching learning activities and initiatives. And she is also trained in highly fidelity simulators, assisting teaching, and research guides for postgraduate and doctorate international evaluator, and also PhD guide and thesis for the thesis, and editorial board member for many research journals, chairperson for Learning Resources Committee. Ma'am have organized 12 conferences and presented 27 papers, and research person for 13 conferences, and poster presentations was 9, and she got cash award prizes in Salita University for 4.
Can you hear me? Can you all hear me?
Yes, ma'am, we can hear you.
Okay, my slides are visible?
Yes, ma'am.
Okay, thank you. Thank you for giving me opportunity to present over here in this conference. Thanks for brief introduction about me also. Good morning to all. Today, I am so delighted to join with you in this 5th International Conference on Futuristic Nursing as a speaker. Our father of nation, Mahatma Gandhi, told us that the future depends on what you do today. This is applicable in our healthcare industries, especially for the noble nursing profession also. The transformation literally means it's a change of form. So to change a form of healthcare, we must reimagine ourselves from the customer perspective. So who are our customers? Our clients, our patients. So here the transformation is very, very important because we need to improve the efficiency of the existing operations in the healthcare facilities. So actually the transformation is ongoing process. New trends are emerging in the healthcare as a daily basis, which means every day we are seeing innovations in different ways in the healthcare system as well as in healthcare services. The transformation actually requires healthcare leaders willing to take bold steps by adopting consumer-centric focus, in shifting the preventive to outcome-based care models, and embracing the digital and technology enablers, engaging the non-traditional value chain partners, and also drive improvement to access, quality, and affordability of the care. Actually, healthcare has been one of the largest sectors, and it is shifting towards the fast advancement at a brisk pace as a transformation. So the transformation is obviously it is a formidable challenge, and that can only be met through a coordinated response of the academic and the practice leaders from across the health professions. So just before Dr. Carol was mentioning about how the transmission has been occurring in the academics. So obviously, the nursing also has a vital role in steering this critical work. So here we have to talk about the nurse-led care exists at the intersection of the multidisciplinary healthcare, where the nurses have the a very important and a very transformative role as a holistic caregivers. So she has the power of decision making in sometimes, and also she will be advocating and leading a leadership roles. So nurses have a unique skill as an insight to treat the whole person, serving as a critical connection between the compassionate and the evidence-based healthcare. So over the last few decades, India has made a significant advancement in healthcare. Though it underwent many crises, we all come across very recently with the pandemic crisis. So healthcare in India is delivered mainly either by public as well as the private care providers. So actually the public healthcare, which is focusing on delivering the primary healthcare aspects. But the private bodies are mostly concentrating or delivering the care on secondary as well as the tertiary care aspects. But we have to understand that both the public as well as the private care providers are mainly focusing on reducing the mortality and morbidity rates, which is occurring due to by many communicable and non-communicable diseases. If you ask me what are the improvements in the healthcare in India, my answer is there are so many. So still I wanted to mention a few here. There are 7 ways the public health in India has changed over the last decade. First of all, a downtrend in the communicable diseases, which is obviously observed. A focus on the prevention and reduced neonatal mortality and the maternal mortality rates. And also the tackling antimicrobial resistance, we could be able to improve in the nutrition aspects, using the digital health and artificial intelligence usage for the social impact and stronger government accountability also. So the national health policies actually have served well in guiding in this approach also. We are all come across this COVID-19 pandemic, which has dramatically changed how the outpatient care is delivered in the healthcare practices. To decrease the risk of the transmitting the virus to the patients as well as to the healthcare workers, Here, we are converting an inpatient visit to the telemedicine visits. So there are many applications are available to get these healthcare facilities. The healthcare transformation is observed by digital transformation, which is utilizing artificial intelligence, then shifting to preventive and outcome-based care models, then quality of services, and also improvement in the accessibility, etc. So see here, I am going to talk about some important aspects here. First of all, regarding the telemedicine, remember the time when you would schedule an appointment with the doctor, we need to wait for a couple of hours in the reception, and either in the hospital or in the clinic. After getting a test done, you would have wait for many days to get the results. Then again, you need to revisit the appointment, and again you have to wait, and you have to get the consultation of the doctor, isn't it? So many innovative solutions are transforming the way the patients interact, and also with the healthcare professionals. So from searching a doctor to scheduling a virtual appointment, and communicating with the doctors via video or voice call, or this telemedicine solution really enable the people's access to healthcare professionals on demand. So the telemedicine evolution is one of the most significant transformations in healthcare system. So one of the best examples of telehealth technology is the virtual appointments. The virtual appointment has taken place between the patient and the doctors. Even in Saudi Arabia, we are using the Sihati app for getting the consultation through online. Next is about the big data in healthcare. Using the big data in the healthcare, the data is transforming a way we analyze, leverage, and manage the data in every healthcare industries. Healthcare is one of the promising industry where it can be implemented to avoid many preventable diseases, and also we can be able to enhance the quality of life, and we can reduce the treatment cost, and we can also forecast the outbreak epidemics. So health professionals can collect a massive amount of this data and find the best strategies to use this data. Using the big data in healthcare can have a positive and life-saving outcomes. With emerging technologies, it has become easier to not only collect the essential healthcare data, but also convert it into valuable insights and to provide better care. Using the data-driven insights, the healthcare professionals can predict and solve some issues before it's getting late. So the big data can be used in the healthcare, and it benefits through patients' prediction for improvement staffing and real-time alerting. We can get the alert, and also informed strategic planning using the health data, and preventing many chances of getting human errors. The next thing is about Internet of Things. It's called shortly IoT. So before the introduction of the Internet of Things, the patient-doctor interactions were only restricted by physical visits and the text communications. Maybe due to this, the doctors or hospitals, they don't have a way to track the patients continuously, track the patient's health continuously, and they may not take action accordingly. But now this IoT enabled which devices facilitate remote monitoring in the healthcare industry, unlocking the potential to keep the patients healthy as well as safe, and allowing the physicians to provide better care. Since this IoT has made interactions with doctors efficient and easier, it has improved the patient satisfaction as well and patient engagement. Also, remote monitoring of the patients, which help in preventing the readmissions and decreasing the duration of stay. By the way, we will decrease the cost of treatment also. IoT can also reduce the outcome of the care. So it's very, in the transformation aspect, we have to talk about this IoT, which is changing the healthcare industry by remodeling the people's interactions in provide healthcare solutions. So implementation of this IoT in healthcare benefits physicians, hospitals, patients, and also the insurance companies. Next, I will be give some gist about the virtual reality. So the virtual reality is the technology that uses the computer generated simulation of a 3D image and environment that really helping the people to realize or experience with the interest. So here they can use either headsets, or they can visualize the things with some special equipment. For example, here in our place here, we are using this virtual reality in the immunization clinic and the children clinic for giving the injection to the children. So they will be really alleviated from their pain little bit because of this. So here the technology really creating the stimulated environment where the users can immerse in. Unlike traditional users interfaces, this VR is really getting or making the feeling of virtual experience instead of only displaying a screen. So here sometimes the patient may feel like they will be immersed into that situation by getting this. For example, especially people, the patients who are spending a longer time for their treatment. For example, in the case of chemotherapy, or sometimes the patients who will be in the dialysis treatment, so they have to spend more time in the hospital. At that time, this virtual reality made her dream come true by stimulating like a beach-like environment where she could, where she or he could feel like they are sitting in the beach and enjoying under the sun bath, something like that. So she's not only the one who's fond of virtual reality in healthcare settings, but nowadays many patients are loving this. Many patients wanted to explore this, and here is this. We are really helping in the healthcare industry. It's the really very big transformation for reducing the pain, pacing up with the recovery, and especially during the physical therapy. And this VR simulation to understand problems from someone else's perspective also. Next, I will be move on to artificial intelligence. So this simplifies the lives of doctors, patients, and the hospitals and admins by doing tasks that are usually done by the human as at a fraction of cost and in less time. So from finding this link between this genetic codes to driving the surgery, or assisting the robots, or surveying the chronic diseases, conducting and risk assessment. So the AI is really reinventing and revitalizing the modern healthcare through machines that can be comprehend, predict, and learn and act. So this AI really providing a number of advantages over a clinical decision making and traditional analytics. So here we have to understand this learning algorithms can become more accurate and more precise when they interact with the training data. So it allows humans to gain unprecedented insights into care processes and their treatment variability. So the patient outcomes and diagnostics. Here some of the ways the AI is really poised to bring some digital transformation. How means by diagnosing and reducing the errors and analytics for the pathology images, sometimes for getting the diagnosed in a proper way. This can be used, converting smartphones, selfies into powerful diagnostic tool. And this was really very helpful for the dermatologists during the pandemic situations, and diagnosing and reducing the errors, management of electronic health records, and drugs and vaccine creations, notifying the doctors when patients are in trouble. For all these things, this AI is posing a great role as a transformation in the healthcare. Next, one more thing I wanted to say here about the Alexa. Actually, the Alexa is a voice assistant. And this was used by, this is from the Amazon, which has already been successful in the lifestyle of the people and the smart offices. In the next few years, of course, our healthcare professionals like nurses, doctors, and even the patients and the pharmacists will bring use of this Alexa in their professions. Actually, this Alexa is in use in the US and the other countries. Actually, you know, the problem in India is we have, this is a multilingualistic country, we all know that, and we have a different kind of slangs and this colloquiality in the language, which makes a little bit difficult to have this Alexa here. Even in Australia and India, they don't have still. But instead, the Samsung company produces Bixby voice assistant in our mobile apps. I mean, in our mobile phone, especially in the Galaxy phone, I think. And also we have in iPhone 3 app, and also some other phones we are using the Google Assistant as a voice assistant. But anyway, in future we may get into this also. This Alexa. So these are some of the few things I would like to share here as a health technology transformations. So finally, I would like to say here in this trend, the nurses must hold leadership positions throughout the healthcare system with unique ability and scientific knowledge and a collaborative project we have to do to design and implement innovative changes to bring it in the health policy as well. So this strategy would help to shape the future healthcare, and we are very sure that this transformation will take us to the next level. Thank you so much for listening. Any clarification?
Great job, ma'am.
Thank you so much, my dear. I'm really happy, and I would like to thank the SFNP for organizing this very mega event in this Narayana College of Nursing Nellore. I have visited twice, I think, to this college. It's really a very big campus with a good environment.
Thank you, Dr. On behalf of this conference organizing, like I am JP thanking you, and you gave a nice presentation. From your detailed presentation of like advancing healthcare transformation in both, if I tell that healthcare transformation focuses on enhancing the health of patients, emphasizing on patient empowerment and promoting proactive participation in healthcare. And that was beautifully brought out by you. Thank you very much once again for organizing for Thank you very much. Good afternoon, virtual participants. The breakout room for the virtual presentation is open. You can go into the breakout room and wait for your session. I repeat, for the virtual participants, the breakout room is open to the room name as Smart Classroom. You can go into the breakout room and wait for your session. Thank you. Now it's my turn to invite Professor Dr. Vijay Devi. Can I proceed with my invitation now?
Hello, is it my name?
Yes, I will talk to Dr. Hajiba Devi, ma'am.
Okay. Are you able to see my slides? Hello? Are you able to see my slides?
Yes, ma'am.
Yes, we can see your slide.
Okay.
Share your slide, ma'am. It is only PPT format itself.
Your voice is not clear. Hi, everybody. Good morning from USA. You know what's the time now? It's 4 o'clock, 4:42. So I'm eagerly waiting to share my information with all of you. I'm very excited. So, let's do a small exercise to be more active. Can you all clap 3 times? So that way, you know, you are cheering yourself. Yeah. Hello, can you all hear me?
Yes, ma'am.
Okay, wonderful. Thank you so much. So I hope it's my turn to start the presentation, so I'm starting it. Thank you so much for the presentation. Thank you so much for the opportunity. I'm Dr. Sujaya from North Carolina Central University, USA. I'm very excited, so I want all of you to cheer yourself for sitting for this long time and listening to various information sessions. So let's clap 3 times. 1, 2, 3. Okay, you're all energetic now. Let's move on now. I want to thank Narayana College of Nursing for taking up this activity, you know, conducting this 5th international conference and inviting people from all over the globe. Wonderful job. I want to thank SFNP for collaborating with this activity. And I want to thank North Carolina Central University, my college, and all our students, principal, everybody. Look here what I brought for all of you. I got flowers from our garden and the sweets for the Diwali festival. You know, we are having Halloween coming up. So I put traditional sweets for all of you. Enjoy the sweets, have the bouquet. This is from our end. I'm bringing the greetings. You can see in this slide, our faculty members, our college, our faculty. So this is one of our international day. You see where I am standing. I'm wearing my sari and working with other people. So I'm the organizer for the International Education Day. You see my other very beloved people, my daughter and Mr. Romeo. Mr. Romeo is the Labrador. He is my energy. So they're all giving the greetings to all of you. And I want to share my gratitude. I'm very grateful for all my students, faculty, colleagues, family members, and everybody. Thank you so much for giving me this opportunity and encouraging me to be active. This is my family. You can see my husband and my daughter and our big hero, Romeo, the Labrador. So what is that we are doing today? So at the end of this, I like to have some interaction, but unfortunately, I'm not able to see anybody. But I assume that you're all listening. And kindly share your information in the chat if you have any questions or responses. So at the end, you should be able to tell the need for the advancement and innovation in nursing. Explain 5 barriers for nursing innovation. Share your action plan, how to become a nurse innovator. So these are our goals. Let us see how we can achieve them. All my previous speakers made my life easy. They covered all this information, like what is future of nursing education. So a lot of information may be repeated. So it's good. So that way, you know, this information is very valuable and you can apply those aspects. But I want to bring a different angle to it. So when you say the topic, you say the topic, advances and leading innovations in nursing. There are 2 key terms. One is advances, other one is innovations. And the key word is leading. So as nurses, we are advancing in our career, in our profession by innovations. So now our job is, what is the innovation? What innovation means to you? Why do you need to have innovation? How can you have the innovation? When do you want to have the innovation? Where do you want to have the innovation? If you remember our previous speakers' information, you can make the connections. They have given very beautifully lot of information, the application aspects. Even in this picture, you can see those aspects. Innovation is needed every aspect of nursing, whether it can be home health, school health, or it can be perioperative, maternity, or psychiatry. Everywhere innovation is needed. As nurses, we need to be innovators. And it should be a continuous process. It should be progressive. Let us see what is technology. Again, why technology is needed, how we can apply the technology, when we have to apply. Again, technology is needed all the time. It's needed everywhere. So let us see why we're not able to get into the technology, or what are the barriers. In the chart, can you please add some barriers, please? Can you add in the chart or write down somewhere and please speak up. I assume you are writing or you're talking. Okay, I'm moving on to respect the time. So usually people have the fear of failure, lack of leadership. And most of the time we work in silos. We are not working in team. That's the reason we are not seeing like what others are doing or how our work is influencing other disciplines. And sometimes we may have very rigid hierarchy. And very important thing is mindset. We all need to have that growth mindset, critical thinking, and we need to think outside the box. And we are very much fear of cost and lack of trained personnel who can train us. So these are some of the barriers. If we are able to overcome those barriers, then we'll be able to achieve a lot of things. We all can become innovators. in the technology and lead our nursing profession to the next levels. What is the healthcare trends? Our previous speakers have mentioned, like we are using that hybrid care model. You know, just now my previous speaker has mentioned, like people go in person, sometimes they go in virtual, like, you know, on call or maybe virtual. They get the appointments and other things. And digitalization is taking place. Increased use of artificial intelligence. Healthcare systems are moving into cloud. Advanced precision medicine and global health. These are some of the trends. And if you see in the future, our previous speakers mentioned this, I'm repeating them. The care should be more personalized care. It should be transparent, client-centered care, so culturally appropriate. That means we have to take care of, meet the individual needs. Virtual care, she emphasized very much on telehealth, telemedicine, telenursing. Nowadays, because of COVID, telemedicine and telenursing has taken up, into the next levels. And virtual acute care is very much used. You may be seeing patients with the diabetes or maybe hypertension sitting at home, checking their blood pressure or their vital signs or maybe their blood sugar levels. So when they're monitoring, they're able to see when the patient needs, what kind of care. So they guide them. And if needed, they're taking care, they're giving education to prevent further complications. And we are seeing a lot of ambulatory care services. When I was a student, long ago, even to have this minor surgery, like cataract surgery, people were admitted, they were there for 4 days. There was big, nursing care. But now people are going on the same day and getting the surgery. So a lot of, care is taken care by daycare without much admissions to the hospitals. And another important one is home health nursing. It's gaining again. And our care should be value-based model and risk-bearing models. And the data, what we collect, are technology-driven strategies. And more private investment is happening. More hospitals and private, travel nurses, they're taking up. The cooperation is very much needed between different sectors. If you see the social determinants of health, health can be achieved not only by, health. So we have to meet other needs like home, food, water, every sectors. So we have to work in teams. Other technologies, when I was a student, we were seeing like, we were counting the drips, like, we were keeping our watch and just counting the drips. Now, if you set up, it automatically does the job. And people wear the portable monitors, like heart pumping monitor, ECG machines, all those things. And wearable technology, we can monitor so much. How many hours you slept, what's their weight, what is their progress. Everything has been done with wearable technologies. And very important aspect is healthcare, electronic health records. They are really helping. And information can be monitored, a lot of research can be conducted, so improvements can be done. Telehealth applications, robotics, artificial intelligence, so all are taking place. They're playing a big role. And I want to give importance to the big data, genetic analysis, clinical data storage, e-consultations, real-time diagnosis, immersive technology, 3D printing, genomics. So all are working on those aspects. I want to bring little information about nursing education. Already my previous speaker has mentioned So what I want to stress is, as nurse educators, we need to use the technology and we need to be innovators. We are using different learning management systems. It can be Blackboard, Canvas, and other systems. Simulation is taking a big role. We are using electronic health records. During COVID time, we learned how to use e-learning like Zoom and other, platforms. Virtual learning, interactive learning, gamifications, all are taking place in the nursing education. So some of the examples of wearable technology, and you can see the future line, lot of information is there. So you can see that technique glove, so they can be, diagnosed, it can be used for diagnosis, for the treatment, for analysis, and for the continuation. The robotics are helping the nurses. So this is my information. Thank you so much for your active listening and participation. I expect you to respond, but I didn't see any response. I assume that something is going on in your brain and you're reacting. So look at my cute doggy. He is Mr. Romeo. So he listened along with all of us. If you have any questions or comments, please let me know. Just I want to share this picture. This is our mannequins during our International Education Week. I dressed them up, our Indian traditional dress. So they are also participating along with us. So share with me your action plan, how you want to be an innovator. Thank you so much. Let me see any chart. If somebody has mentioned any chart. Any questions? I hope I spoke to a group of 300 people, so I want to hear at least one beautiful voice.
Ma'am, thank you, ma'am, for your valuable session. It is very informative and wonderful information you had given to us, ma'am. Thank you very
Okay, thank you. Bye-bye.
కాదు ఒకసారి ఆ బోర్డు దగ్గరికి వెళ్ళవా ఇదో లైట్గా ఇటు తిప్పాలి వెళ్ళు కొంచెం ఇటు లైట్గా ఇంకొంచెం ఈ లైట్ ఆ ఫ్యాన్ అవతల పెట్టలేవా అటు అటు జరుపు లైన్ కొంచెం అటు జరుపు మేడంకి కరెక్ట్గా మేడం సైడ్ తిప్పు మేడం సైడ్ తిప్పాలి చూసుకొని చిన్నగా ఇదేం లేదురా నన్ను పై చేపించేస్తారు మేడం మాట్లాడుతుంది
It's my personal honor to invite Professor Dr. Hazar Bibi Florina Abdullah, Pro-Chancellor, Lincoln University College. She is a Pro-Chancellor, Lincoln University College from 2008 to till date. She is the ex-Director of Nursing, Ministry of Health, Malaysia from 2004 to 2008. She is ex-Register of Nursing Board, Malaysia as a Pro-Chancellor of Lincoln University College from 2008 to till date. Dr. Bibi ma'am, she is so committed in excellence in teaching, research and social activities by offering equal academic opportunities to all privileged students and the rural areas in the Sabah to the trained as a successful nurses and doctors. She has provided employment for many of the poor people and she has helped them a lot. I welcome you, ma'am, for presenting the topic related to emerging technologies in global nursing care. Thank you, ma'am.
Hello, thank you very much for that kind words. Good afternoon and namaste. We are still, Diwali. Happy Diwali to all of you. First of all, I would like to thank the organizing committee for inviting me, and I'm very, very happy to be with good people this afternoon. So actually, it's greeting from Lincoln University College, Malaysia. It is around 5:05 p.m. in Malaysia at this time. So the topic which I am going to speak actually has been well spoken in detail by our previous speaker, yeah. And then I think I will just, have to summarize it. So basically on emerging technologies in nursing care in the context of with the Industrial Revolution 5.0. So if you care to look at the, Industrial Revolution, it first started with the in the 18th century, basically, when we have the Industry 1.0. It's more on, mechanization using water or steam to start the industry. And then we go on to 2.0 on the using of electricity on assembly line. And of course, 3.0 on the automation, using computers and also automation. And the 4.0 was more on digitalization, on networking and communication. And what I would like to speak actually today is in relation to the Industry 4.0, that is on personalization in terms of collaboration and sustainability. So at these present times, actually health industries have started focusing on personalization of products, yeah, according to unique and special requirements for patients with different diseases for all the disorders. So in the new normal, especially after the pandemic, human-centric solution that induces Internet of Things and artificial intelligence in healthcare is actually in the limelight. And in this fifth industrial revolution, personalized requirements of patients and healthcare professionals have been given very much importance. So we are moving actually. And currently, the health industry stresses on personalization along with the human touch, because we are all nurses, so we cannot compromise on the human touch. And this industrial revolution allows interaction between people and machine, so to make the work better and faster. So it's basically on the interaction, how to handle the machines for nursing care. And the Industry 5.0 has interconnected much machine improvement for productivity and of course the human touch. And the journey of this industrial revolution actually has grown to this massive growth in terms of quality, in terms of safety, reduction that will optimize digital revolution. So when we talk about Industry 5.0 in its application in the medical field, personalized medical implants, that includes, as we have made the previous speakers mentioned, and also artificial organs, body fluid transplant are manufactured precisely in this revolution, enabling technology of Industrial 5.0. So in this new world, a sensor with artificial intelligence can actually, minimize the data quickly, and machines are flexible to make a high-level decision on the individual needs. Yeah. And then in this medical, hold on, just hold on, I have to take this one. Hello. Hello. Sorry, I have a little bit of technical issue. Give me a minute. I just have to adjust my slide because so in medical, these technologies can measure and monitor the human body variable precisely as per the requirements of the patient. And this actually will help to track the body response with improved performance. So that is what actually we need, because we want to know, what is the outcome. So thus, this makes the healthcare connected to accurate information digitally. So we will minimize the medical error. So the continuous development of the technological advances in healthcare is generating a completely new approach to nursing practices that are providing beneficial to both nurses and patients. So actually, we're looking at technology as something which will help, nursing care. So while COVID-19 pandemic actually has served as a catalyst for much of the sudden technological changes in healthcare practices, so these advances have been increasingly improved throughout the last few decades. So as we move into the next phase of industry development, these technologies are predicted to have a lasting impact on the healthcare industry as a whole. So emerging technologies such as genetic, small inconspicuous monitoring devices, and information and communication technology are devices to help in the communication process more effectively in the healthcare system. As I said, it will minimize the medical error or will speed up the decision making. So these new technologies have the potential to be utilized for universal healthcare or U-Health. And the importance of nursing in U-Health is critical to its success and its expansion. So all these technologies will eventually focus on the customer, allowing nurses to evaluate the data to improve treatment. So it will be much easier for us. So we must realize that information technologies are becoming more prevalent and widespread. So we need to adapt. So U-nursing has thus emerged, which means the provision of nursing services to anyone or any organization at any time from any location via any network and devices, especially in the remote areas. For example, in some of our countries like Malaysia, we have islands and, remote clinics and all that. So, this will help the nurses in those remote areas to get help actually through virtual. So the future job of nurses will be actually to assist patients in using technology and to facilitate information interchange. So don't be, like some of the nurses said, so what are we going to do if the machines are going to take over our job? But actually, we need to assist. We need to learn how to, as I said, it's an interaction of the machine to the nurses and to the patient. So we are acting as a catalyst actually. So healthcare and nursing will be driven by technology, and nursing will have the chance to harness that technology to offer higher quality evidence-based care. So you will not go wrong. So when you talk about new technologies in helping patients, what are we talking about? As more of the population ages, as life expectancy increases, and as nursing shortage continues, new medical technologies are vital for continued patient care and the healthcare system. And new medical technologies can make life easier for medical professionals and for the patients too. And technologies can also make patient care more easier and more efficiently for the doctors and nurses who manage especially a large patient load. So they can also support patients by making care more convenient and more accessible. So these new medical technologies can help the nursing profession in routine processes, as well as decrease human mistakes and errors and decrease the workload. So while nurses agreed that new technology and healthcare technology and innovative medical devices can help them, they also agreed that technology must not replace routine human interactions. So working directly with patients is a huge element of healthcare, and nurses provide a crucial element of interaction that comfort patients and hasten the healing process. Okay, so we are working together with the machine. So working with families, explaining procedures, and helping to take a patient's mind off their sickness are all part of nursing jobs. That is what we're doing actually. And many healthcare professionals worry that increased healthcare technology could try to remove that human element. But unlike in other sectors, the healthcare's human interaction is crucial for patient success. So it's crucial to find the right balance between technology and the human touches that make nursing and healthcare successful. We need to see what is the balance like. So professionals also largely agree there must not be an over-reliance on healthcare software and technology. The human eyes on both symptoms and needs is important along with healthcare technology. So basically it facilitates us, it helps us, it's like complementing our work in terms of, diagnosis, in terms of treatment, and in terms of patient care. So while technological advancements aren't a cure-all as healthcare solutions, a new technology is changing the way nurses work in a positive ways. Whatever it is, technology is moving and we need to change. So there are several technologies transforming medical care, as was mentioned by the previous speaker. So nurses must be educated about these new medical technologies and must practice patient care and must use these technological advances in a beneficial manner. So when you talk about emerging technologies, what are we including? So basically, it includes artificial intelligence, virtual reality, and the Internet of Things, which are steadily becoming available globally to nurses to optimize care delivery and routine operations critical to patient care worldwide. So robotics, cutting back on monotonous tasks, medication management, disinfection, carrying medical devices, lifting bedridden patients, navigating and greeting patients and relatives in the hospitals are all tasks that the robot could support, and some of his hospitals are already using it actually. So in terms of monitoring, we have portable monitors which give nurses the freedom to check on patients quickly, even when occupied with other tasks. So nurses receive an alert if a patient needs urgent attention, which significantly reduces the response time, which actually is very good for nursing. So in terms of medication, the nurses is in most healthcare settings no longer need to make rounds to monitor patients' IVs, as smart pumps allowed for the more accurate and efficient administration of medication and also fluids. And in terms of health record, using EMRs, nurses and other medical professionals can quickly access critical patient information and reduce or eliminate the need for paperwork. So we have also smart beds, which allows nurses to monitor patients' weight, movement, and vitals, which can help prevent bed sores, injuries, and misdiagnosis. Technology-enhanced bed also reduce the amount of time nurses spend on adjusting equipment and supplies for safety reasons. So in addition to hospital, increasing numbers of nursing homes use actually smart beds now. And also, of course, it reduces errors. Technology considerably reduces the likelihood of error in logging patients' information like medications, medical history, and health conditions and illnesses. Apps make the administration of medication much less confusing or prone to human error. So this, in turn, improves the health outcomes and reduces hospital readmissions rates. So in terms of communication, today's nurses use team collaboration tools, instant messaging, and headsets that allow them to communicate with their colleagues in real time. So these tools make coordinating much easier, and as they reduce the time required to assess the test results, along with identifying and diagnosing illnesses. To improve communication also provides for more efficient patient handover between departments. And patients also can increasingly access the medical professions, including nurses, from the comfort of their homes, thanks to mobile apps. These are the telehealth. So nurses advise patients on many health concerns, while patients update their own data to the apps, so that medical professionals can best monitor their conditions and their overall health on a regular basis. So actually, we need to embrace change and we need to adapt ourselves to the technological advancement. So in conclusion, appreciatively, the advancement of technology in nursing practice has improved nurses' performance in daily duties. And in fact, more connections between nursing and technology help nurses to spend less time with menial tasks and more time with the patient, actually. And that is our main job. So technology is also improving standards and quality of care in nursing through the delivery of evidence-based practice and support for clinical decision-making. And many healthcare providers have now adopted technologies that provide data-enabled clinical decision-making and support evidence-based nursing practice. So nursing education and nursing research will change to encompass a differentiate demand for professional nursing practice. So when challenged by the rise of technology, but as long as nurses are willing to grow professionally and become even better versions of professionals, they can become remarkable healthcare providers with improved nursing care. So the most important, as I said, we need to embrace change and we need to be innovative and we must have the initiative to learn what's going on in the world. So basically, what's the changes and the new trends, and I would like to congratulate actually, Narayana College for this very good sharing of information on this conference. So basically what we need is future research, and I'm sure this conference, can provide that, should be devoted to a closer examination of applied technological evaluation methods. Yeah, we need to do that. And policymakers, in fact, we need them, especially in providing funds to enable large-scale long-term evaluation of technologies in the practice of care, filling the research gaps of technology. Thank you very much, and thanks for your attention once again.
Thank you very much, ma'am. Thank you very much for your valuable insights related to emerging technology, nurses, how the nurses can utilize this technology in a day-to-day life. It was so informative. Thank you very much, ma'am, from Narayana Nursing Institutions.
Thank you.
Hello, ma'am. Yeah, this is Smita. Sorry for the inconvenience. You waited a long time, I think.
Yeah, okay, it's okay. I understand. This is one of the, what do you call the advance of technology, which we need to adjust ourselves and adapt to the change. Thank you.
Thank you, ma'am. It was a wonderful session. Thank you very much.
Thank you very much. Now, I call upon Majeline ma'am and Pavitra for Subhashini for a scientific presentation. Majeline ma'am as a chairperson and Subhashini will be the moderator for the next coming sessions. Please come, ma'am.
Data on பண்ணிட்டேன். Good afternoon, ma'am. Share பண்ணுங்க. Share பண்ணிடல வா. மா இங்க வா. Share பண்ணு. Hello, good afternoon, ma'am. Can you able to hear me, ma'am? Hello. இது போடு. Video start video போடு. Hello. அதை கட் பண்ணு நெக்ஸ்ட் ஆகு. Hello. Ma'am, can you able to hear me, ma'am? Hear you. அடுத்து போயிட்டாங்க அடுத்த person.
Good afternoon to all. Now I invite Professor Smita PM, Head Department of Mental Health Nursing, Narayana College of Nursing. She is a key planner with the demonstrated abilities in ensuring quality standards in teaching and patient care, and also proficient in ensuring effective use of nursing standards in school or college of nursing. Her educational credentials are graduation from Padmavati College of Nursing, Dr. NGR University in 1998, and post-graduation in psychiatric nursing from Salta University in 2008. Currently pursuing PhD in Lincoln University, Malaysia, and head of mental health nursing department, Narayana College of Nursing, Nellore, Andhra Pradesh. She has completed 18 short courses, and her professional accomplishment mentioned more than 20 years and 8 months of experience. She has presented scientific papers at various national and international conferences and published her work in different journals, indexed in Scopus, PubMed, and Medline. She has organized national and international conferences and seminars, chaired various scientific sessions, and the convener of the international conference by ICHWA 2022. She has received Outstanding Teacher Award 2022 from Research India Foundation and International Best Researcher Award 2022 from ISSL International Research Award. I gladly invite Madam to present the topic on telehealth, e-health, and mental health. Thank you, ma'am.
Bagi battery తీసుకోవా battery
Good afternoon to one and all. This session is comes under physical to digital, future of nursing. Continuing with that, many other sessions is coming. I'm going to talk about telehealth, e-health, and m-health. What we can see here is from the past 2 years, we have seen because we were suffering with COVID-19 COVID infection of problems like this type of treatment.
हमने क्लास
So when it is coming to telehealth, let me start with the first topic, telehealth. Telehealth refers to both clinical and remote non-clinical services. I know many people are getting confused with what is this telehealth and what is telemedicine and what is e-health and what is m-health. So almost all these terms are same only, but still, what we can say here, there are minor differences are there. Telehealth in the sense, we will take it in a broader sense. So that means it has both clinical and remote non-clinical services. So after that, when we are seeing, when I'm saying about telehealth, I should say about telemedicine also. What do you mean by telemedicine? So telemedicine here in the sense, it is refers to remote clinical services. So when it is coming to the broader aspect, we will say telehealth, and when it is coming to the narrower aspect, what we can say is telemedicine. Telemedicine, anyway, I am not going to talk about telemedicine. And telemedicine only talk about, I mean, only consider the remote clinical services. But telehealth, in a broader sense, it is saying like both clinical as well as remote clinical services. So here, the next one is types of care can get with telehealth. What are the types of care we can get it through the telehealth? So here, as you see here, lab test or X-ray result will be getting mental health treatment, especially mental health sector. We know that there is no need of much physical assessment or something like that. So we will be concentrating. We can get many type of counseling or any other services through this telehealth for mental health services. So including online therapy, counseling, medication management, all those things we can get it through telehealth. Then recurring conditions like migraines or urinary tract infection, those are minor treatment we can get it. Then skin conditions, then prescription management. So that also you can see here. And next one, if you see urgent care issues like cold, cough, and stomach aches and all, the post-surgical follow-up, mainly telehealth, the telemedicine and all, follow-up will be happening. Follow-up can be done in very useful way. Then treatment and follow-up appointments for attention deficit disorder like ADD will be seen, and the attention deficit hyperactivity disorder ADHD. For all these things and all, for treatment as well as follow-up also can be done through telehealth. Then physical therapy and occupational therapy. Then occupational therapy, you may wonder that how the people will get occupational therapy, but this is some occupational therapy in the sense, so they'll get some guidance how to do occupational therapy and how to go with that.
Then remote monitoring services that help you to track your health work and manage chronic conditions, especially of course diabetes, high blood pressure and high cholesterol and all. Here what we can see is we will get a remote monitoring service. It's not necessary that every time we need to go to hospitals and we should get some type of treatment all the time. So through telehealth we can go with the follow-up. Then this is the pros and cons of telehealth, the advantages and disadvantages of telehealth. When you are seeing here, pros in the advantages are it helps rural areas. We can concentrate more on rural areas. The people no need to come to the hospital all the time for getting the treatment. And then cuts cost, it reduces spread of illness, easy follow. Then it saves time, it is very convenient, then reduces cancellations of hospitals and reach more patients. So through telehealth in the sense people can go more, get more and more services. Then the next one is disadvantages of cons of telehealth. So the first one is it relies on internet, and the other one is requires technology devices, because we know that this is completely with the technological aspect. So if you don't have proper technological facilities in your home or the place where you are staying, it will be very difficult for you to access it. Then generational differences, of course, I mean, I'm not saying that the old generation, they don't have, what is that, they cannot operate with such type of things, they can operate, but still some limitations are there. This is like the people young generation, they'll be using all those things very fast. Then limits assessment. We cannot go with any type of physical assessment and all. So here assessment problem will be there. Then geographical barriers depends upon the remote area and where they don't have any internet connection or something like that. So that will be one of the problems. Then security. So security problem. Always whenever you are using whatever type of electronic devices or digital devices, there will be a security problem always. So that might be one of the disadvantages. And now, so this all, if you go with telehealth, I said it's a broader sense. And when it is coming to e-health now, this is again little more broader, because all these things, whatever I said now, telehealth, telemedicine, m-health, all these things will come under e-health only. So now e-health in the sense, it consists of a broader understanding of healthcare practices supported by electronic process. So all the electronic ways of treatment can be comes under this e-health. Then the technology used to improve healthcare practices with e-health includes health records, patient administration system, lab systems, other records that cannot be sorted within mobile health applications. I'm going to talk about again m-health. I mean, m-health in the sense it's nothing but mobile health. So when we cannot able to some operations we cannot do it. Some limitations are there with the mobile health. So that thing and all we can do it with e-health. So next we will see here domains of e-health. So what are the things what I was just discussing? All those things is comes under here. You can see here telemedicine is there. That is remote non-clinical remote access service, that is telemedicine. Then clinical information system. Then e-prescribing, integrated networks, big data saving and all. Then m-health. M-health in the sense it is mobile apps. And other than that also we can see that e-health, that is through the watch also nowadays people are using all these health related services. So now we can see what are the 10 E's in e-health. So what are the 10 E's? These are the things which will include in the e-health services. One is efficiency. How the efficiency we are saying in this is there won't be any duplication, unnecessary duplication, and streamline healthcare services between patient and provider. So this way we can make sure this service is very efficient. Then enhancing quality, that is through the providers have access to each other's notes. Avoid duplicating any previous exams or studies. If they have gone through with any type of previous examinations or previous diagnostic measures, that can be avoided. Then evidence-based. So this is, we know that it is evidence-based only when we are using this e-health and in-health all those things, it's all evidence-based. And empowerment, it should empower patients to be part of medical process. Then encouragement, it is improving the relationship between healthcare provider and the patient to work together. Then education, of course, when we are going with this is all new technology. If you think just 10 years back, how the treatment or how the medical services was there in the sense, from that period to this time, there is a enormous growth is happened. So that means people are, according to the situation, what is happening in our world, according to that, we are also trying to move. So one thing, if it is not possible in this, we'll try to find new way of getting some type of treatment or services. So if we see that way, education which is helping. Each and every people is learning something by using this e-health and telehealth, all those things, and enabling in the sense it is allowing easy communication between healthcare providers and patients across the world. Then extending, allowing healthcare services and assistance across the globe instead of relying on your set geographical location. So what we can say here, if you want to get some treatment nowadays, it's not what is that? We cannot say that it's not possible or something like that. If you want to get a global, I mean, from the world, some other part of the world, if you want to get some treatment in the sense, that also it is very easy to get it through this e-health. You can consult a doctor from Canada or US or UK. Very easily you will get all the information and you will get some type of services from there. So this and all is possible nowadays. And another one is ethics. Maintain the same values of professional practice, informed consent, privacy, equity, everything is there, how you people are following in the day-to-day life, everyday life. But equity makes healthcare more equitable for users. So these are the 10 E's of e-health. Then what are the pros of e-health? Pros in the sense, the advantages of e-health, as I said you, the point is repeating here. It is education, because we are getting one of the other type of education through this, or that means we are learning something. Then convenient, it's very convenient for the people. It's not necessary to go directly there and get the treatment, all those things, and also very convenient. And the timings also, if you see, if you want, it's according to your job timings. You can change the timings and all. If you want, you can get an appointment morning or in the night also it's possible. So that and all is not a problem here. Then we encourage this healthy behavior. So when you are using some type of e-health, you are getting many information, and you will start applying some type of healthy behavior in your day-to-day life. Then next we will see the health. Health is mobile health. It's an abbreviation for mobile health, and which utilizes like mobile devices such as cell phone or tablet. We can, as you can see here, nowadays people are using in the, many apps are there. So with the apps we are using such type of services. So with health services, patients are able to log, store, and monitor their health records on their personal mobile devices itself. If you have a mobile, nowadays we know that all the information we are having in the mobile itself. Health apps are not there. Nowadays, so many health apps are there. So with that, we are and what is also people are using. So with that, people are getting such type of services, and these applications are very helpful in improving the efficiency of development of healthcare information. And these applications have been very helpful in research and practitioners also. Like the people, someone who is doing some research, or else the person who is a practitioner, what they can do with this is not necessary for them to go and monitor the patients who is, or the participant who is there in their research. So what they can do is they can connect it with the mobile services itself. So they can monitor them, like their blood pressure, their what is that sugar level, all those things, and even their heartbeat, everything we can monitor it. And previously it was difficult for us to go with a large data. What we can say is so many people are there in the such participants in the sense. Nowadays it is not like that. Such type of facilities are there. There is no need of any research assistant when you have this type of research. Because now also research assistants are there. Slowly that also will stop. Instead of that, the technology is coming, new technology is coming. And additionally, health tracking apps. That is what I said. The person, the doctor or practitioner is there in this one, and you know that nowadays there was last month we had a workshop on nurse-led clinic. So that from AIMS, Dr. Gopi Chandran sir came and he has conducted a workshop with the nurse-led clinic for cardiac patients monitoring and all. So that's very useful. He is the founder of one app. can be monitor the heart patient's conditions and all. The same way here, so many health apps are there. You can see here, 3,80,000 health apps are there in the market nowadays. So, according to your convenience, you can use any type of apps. So here, what are the types of health assistance you are getting? Medical and diagnostic assistance will be getting through the mobile app. Health-related alerts will be getting. That means it will be alerting you that this is your time for taking medication, or every year for a checkup in the sense it will give you an alert that today is your you have to go for that one. So like that, some type of health alerts will be there. Then medical reference will be there. Then health and wellness promoting will be there. So that means how you are changing, how you are supposed to change your lifestyle behavior. So that also you can get it. So this is here some of the health app examples for health. So many health apps are there. I just want to show you only 3 health apps here. One is Fitbit. So this is through a watch it is working. Fitbit is one of the one. Another one is Google Fit. So Google Fit you can download it from Play Store itself, Google Play Store itself. Another one is Apple Heart Study. This is through Apple. You can go with the iPhone, or else you can go with the Apple Watch. So this one you can use it. So these are only 3 I have shown here. But I said you like more than 3 lakhs apps, mobile health apps are there. Now we will see what are the uses of mHealth. So mHealth in the sense it is the ability for healthcare professionals to track. I have already said you if the patient is in a remote area also, tracking their health condition can be happened through this. The another one is when hospitals and healthcare become more reliant on technology, more and more hospitals they are using these health facilities, so they can access records, make appointments, and they can clarify their questions or doubts and all through mobile devices itself instead of visiting the hospital. Other than that, what are the benefits here in the sense? It reduces the cancellation. So almost now talking with the third one, like telehealth, e-health and mobile health. If you see the benefits or pros of each 3 things, it is all have the same benefit, reduce the cancellation. Then another one is medication regularity. So before going with medication regularity, when I'm saying reduce the cancellation in the sense because of many things, like sometimes we cannot reach the hospital at time, or sometimes that we may get some sudden appointment or something like that. So these are the things when we are going with directly, this is all like a time consuming. But here, if you see, it is not time consuming. According to our time, we can do this one. Then medication regularity, then reduce the healthcare expenses, going and coming back, all those things we can avoid it. Then reduce administrative burden. Then medical billing, very simplified medical billing you can do with it. It's all online. Then caregiving efficiency, then optimized medical data. So these are the medical benefits of mHealth development. Then these are the challenges or cons of mHealth. One is personalization. Personalization, I have told you, like even though all the people are using all these services, still we have to go with some type of personalization, or else we can say each person is unique and their need is unique. So what will happen here is the developers, this mobile health app when they are making, those developers need to find right mix of features for each user. So what is their need according to that? For example, one type of patient is hypertensive patient. What is their need? According to that, you have to even then also most of the things they can consider the common needs of the people. So according to that they can make it. Then sometimes it may not be possible, even though they are making it, it may not be possible to satisfy each and every users. Then data input, because these apps are only as useful as the information they have about a user. And data input, whatever we are keeping in that particular app, that only the data will be available. So that is one drawback for this. And so to prioritize easy manual data entry, that area these developers have to they have to focus. Then data presentation, here so much of data will be sometimes kept it in that. So apps need to be able to summarize, and instead of keeping the whole data done together, they have to make it summarize and make it so simplified. And security and privacy, that I said you like already, whatever the services like electronic services you are using, there will be a security threat will be there. So in these three conditions, like e-health, telehealth and m-health, all these three places you can see this security and privacy problems will be there. So these are the challenges what we can see here. So what is the conclusion here finally is, like more people when because of this type of services, more people can get the services and their expectation around the waiting room times, access to care and convenience of care is changing because of these things. Previously, the people will be going to hospital in the sense the whole day work, that is morning itself, we have not whole day also. We may try to get appointment 1 week before itself or 1 month before itself, trying to get the appointment. After that, we will be going to hospital with the appointment also. You may have to wait the whole day sometimes. So this waiting time and we can just avoid, and it is very convenient for the people to use this type of this one. So these are with the telehealth, e-health and m-health. Well, I think many of them are sleeping. If you have any doubt, you can ask about this.
Thank you, Smita. Thank you very much for this interesting topic and this discussion. Thank you very much for this interesting topic and this discussion for the nurses and even the general public populations. And the quality and the caliber of the speaker is outstanding. Thank you so much.
Now I cordially invite Ms. Lalita Kumari T, Head Department of Mental Health Nursing, Sri Narayana Nursing College. She is fervent in teaching nursing students with innovative and very enthusiastic in clinical services. She has completed a master's in mental health nursing from Sri Venkateswara Institute of Medical Sciences, Tirupati, and having more than 25 years of teaching experience, currently working as Associate Professor in Mental Health Nursing Department, Sri Narayana Nursing College, Nellore, affiliated to Dr. NTR University. She is a member of professional organizations, nationally and internationally, worked as teaching faculty in Kingston School of Nursing, Kingston, Jamaica, West Indies. To add and credit, she won the Best Reader of Bhagavad Gita conducted by Tirumala Tirupati Devasthanam, Tirupati. She won the Best Teacher Award for the academic year 2022 by Research India Foundation and UIJR Academic Research Foundation. She published papers both in national and international journals. It's my privilege to invite ma'am on the dais to present the topic on e-nursing and tele-nursing. I welcome you, ma'am. Sorry for the inconvenience. Before I start my session, let me ask you some questions to the audience. After having delicious food, I think we are having nice sleeping here. So what is the tele-nursing and e-nursing recently we exposed in our hospital? I think all final year students and third year students also experience this tele-nursing and e-nursing. Can any one of you answer me? Even MSc nursing students also can answer because we worked last year and last before year. Yes? Can you answer me? No? No questions, madam, after eating. Delicious food provided by the organizers.
Hello. College దగ్గర ఫోటోస్
Thank you. So welcome you all for my presentation. So as I said,
బాబు ఏంది పంచాయతీ
Gender, it's coming to the field.
మన టైం అంత అయింది. కానీ కింద వేసుకుంటాం. కింద అయితే అలాగే కూర్చుంటూ ఉండొచ్చు.
Okay, ma'am. Sorry for inconvenience. See, change is the law of life, and those who look only to the past or present are certain to miss the future. So everybody needs some change so that we'll be adjusting to the technology and we'll be moving on our life. And here, when you come to this, I told you already, Mrs. Smita covered almost my topic. We will see what is tele-nursing and what is e-nursing. So tele-nursing, it is the practice of nursing over a distance by using telecommunication technology. Either it may be mobile, or either it may be a video call, or it may be anything that you can use the technology and interact with the patients. So nurse-patient interaction through the communication device. The device may be different forms. That's what I asked the first question. Last year and before year, we taken care of all the patients with the COVID through tele-nursing only. So tele-nursing,
It is the use of telemedicine and telehealth technology to deliver nursing care and conduct the nursing practice. And this domain was given by Encyclopedia.
So,
Can anyone help me to go?
bro. Madam, కనబడట్లేదు.
So if you take this examples of telenursing, these are the various examples: phone interactive video, phone triage. What is mean by phone triage? You can call somebody or you can make a video call and make the triage system. Triage system means green and yellow, red, and you all know what is the triage. So according to the priority, that care can be given. And internet support also, we can take care of the patients, both education and the treatment wise, and also remote to telemonitor. So any remote areas also will be able to communicate with the patients and patient attendants, as well as include the family members also. So what are the uses of this telenursing? So it is used as a tool in home nursing. People who are immobilized, that means those who are not able to stay in the hospital for longer period, and they can be taken care of in the home itself. Through telenursing, we can educate them how to take care of the patient, how to feed the patient, how to change the position. These are all the uses of telenursing. And citizens who have chronic ailments such as diabetes mellitus, COPD, and CHD. So these patients can be taken care of by telenursing. Instead of making them to stay in the hospital, we can send them home, and through telenursing we can take care. So in home care delivery, a nurse is able to reach and care for 5 to 7 patients. This telenursing will help us to give more time and more care to the patients with the help of the family members. It is also used by call center separated by managed care organizations, which are staffed by the nurse manager. So nurse manager can be inspecting all the members, whoever is participating in the care of the patient. Okay. To perform patient triage, so which one is priority, that you can categorize, and in emergency cases, we can divide and we can provide the care for the patient. And also we can discharge services also can be provided through telenursing, and expert assessment and interventions can be advised by the specialist, and this specialist nursing care can be given by the nurses who is taking care of that particular patient. So what is nurse informatics? So through telenursing, the information what you get is collecting the data from the patient and assessing and getting the knowledge regarding the condition of the patient, and you will be diagnosing and you will be documenting whatever the data you have collected from the patient. That can be given by using your critical thinking skills, as well as you can provide interventions by whatever the data you have collected, and that can be referred to the higher specialist, and that care can be provided by telenursing. So what are the implications of telenursing for the patient? So if it is for the patients, so what is the implications for the patient means, as I said, the total nursing care depending upon the triage, depending upon the priority you can provide. And if it comes to healthcare setting, so healthcare setting means it's an organization or an institution or in a hospital. So initial expense will be more, but that can be improved and the money will be saved by providing telenursing. The decreased number of in-hospital days. In-hospital days means the stay of the patients can be reduced by using the telenursing. Decreased number of in-hospital days, and also reduces the required number of staff. So everywhere we have scarcity of nurses in the hospital, both India and worldwide. So that number of nurses also can be reduced by providing telenursing, and it also removes barriers of time and distance. So from the far distance, when you get a call or when you get a video call, by instructions we can save the life of the patient.
and proper training and administrative support should be there whenever this system is implemented in any organization.
So the application of tele-nursing. So application of tele-nursing can be used both home care as well as telephone triage and case management. So here, from our hospital, Narayana Hospital also, we used to take care of case management case, that is getting history from the family members, and will be instructing and calling the doctors and getting the instructions by the doctors, as well as we used to educate how to take care of the patient, how to give the feeding to the patient. Then what are the advantages of tele-nursing, we will see. So it increases the public access to the healthcare, and it provides access in the rural area, and it decreases the waiting time, and it decreases the unnecessary hospital visits, and decreases healthcare cost, and also it increases the continuity of care, and increases the patient compliance with the aftercare. So those who are unable to come from far places, they'll be getting information through tele-nursing. So what are the disadvantages? So it decreases face-to-face interaction sometimes. So face-to-face interaction is very important in critical condition, but it decreases the face-to-face interaction. So risk of decrease in quality of care. Sometimes through tele-nursing, no, we may not be able to provide whatever the care we plan. So that will be will have a risk of quality of care. So it may increases the liability, and also it is concerned with the security, and sometimes it is concerns with the maintaining of confidentiality. So all the media or
through video call, we are getting the information, we may not be able to maintain the confidentiality. So legal issues. So in this case, tele-nursing will have some legal issues like maintaining patient privacy. We sometimes may not be able to provide, and verifying the consent, compliance with the hospital rules and regulations, nursing licensure across the state lines, and maintaining the compliance with the scope of practice. So ethical concerns. So maintaining privacy, you have to maintain. And also you must be able to maintain autonomy and identity, maintain the patient's integrity, and prevent the harm to the patient. Then future of nursing, tele-nursing, ongoing development of new technologies will provide endless possibilities in the future of nursing care. That's what we are discussing from the morning. So here, when you look at these pictures, what is happening then now? So this was the olden days, and this is now how we used to, like bookworms we used to work, and that is now how we are improving. The money wise, you see how we are transacting, and the telecommunication, how we are improving. So the use of information technology in the provision of nursing services, whenever the physical distance exists between the patient and nurse, or between any number of nurses, even one nurse can cover many of the patients. Then the goal of e-nursing, we will see now. So what is e-nursing? So here, to enhance the nurses to benefit from all the developments in the information, communication, as well as technology, to improve the nursing and client outcomes. So what is the importance of e-nursing? So to enhance, it has got a tremendous potential to improve the practice of nursing if applied in appropriate and useful ways. So these are the styles in e-nursing. One is offline and online activities that can be synchronized and asynchronized activities can be done, and different multimedia can be assets can be used, and different didactical interactions can be done. Both different ways of delivering content as well as self-study can be done, and there is a chance of getting more information, more learning experience will be there with e-nursing. So what is the theory of e-nursing? We will see now. This is andragogy and constructivism. What is andragogy and constructivism? We will see. Andragogy means it is an adult learning. Why we are discussing here e-learning means the adult learning may be helping us while providing the e-nursing for the patients. So the past experiences can be used to provide the learning experience to the patient as well as the nurses, and the learners must have as much as autonomy as possible. Autonomy means independent learning can be done and independent care can be provided through e-nursing. So this is pedagogy and andragogy, how the care can be distributed to overall. So constructivism. So it is a theory of learning. So in learning, we can assume and gain of knowledge through construction of all the learning experience, and you can use your knowledge to provide the care for the patients. So e-learning aliases means here this e-learning can be given like a false names, which is called online learning, training, web-based learning and training, virtual learning, distributed learning, and distance learning.
Hello.
So in asynchronous learning networks, technology supported mediated facilitated learning, network learning, electronic learning, collaborative electronic learning, electronic performance support. This why we are discussing all these means. All the methods can be utilized while we are providing e-nursing to the patients or whoever is consuming our services for their healthcare. Now, what are the issues of e-nursing? So sometimes we may not be able to, even when we are providing COVID-19 patients care, no, we were unable to provide the care for the patients because of some disturbances in the technology. So that issues are availability of funds, sometimes level of computer literacy. Just now we faced some problem now. If you don't have a technological knowledge, that cannot be provided promptly, and commitment is more important when we are providing the e-nursing. And when we are providing care, no disturbance should be provided. No disturbance should be there for patient care. So empowerment is more important. Sometimes we will have a cyber phobia also. Confidentiality is more important. Then, what are the skills the e-nurses must have? One is basic computing and communication skills, use of pre-designed packages, and assembling the internet resources should be utilized. Whoever is providing the care for the customers. Then, what are the top online learning resources for nurses means? Number one is Learning Nurse Research Network. American Nurses Association is providing more resources, and Health Resources and Service Administration, the Nursing and Allied Health section, nurse.com. So this is another website, that is Technology Enhanced Learning, Medline and Simhal. So you can use these all technologies while providing e-nursing. This is another website which you can learn, www.medicine, www.medicine health, as well as MediaBee.net. And there are other websites, like different websites are there. Now we'll see what is the advantages of e-nursing. So e-nursing will have an integration with the information and communication with the technology, as well as the total team will be included in this e-nursing. Improved information and knowledge in the nursing practice, as well as human resources planning will be facilitated. So the new model can be utilized by nursing practice, and the group will be well connected through e-nursing and improve the quality of nursing work environment, as well as it will contribute the global community nursing. So who are the beneficiaries? So individual nurses will be benefited, the clients will be benefited, the employees means they can save the money, they can save the time, and also number of labor also can be reduced. And the nursing professionals can be utilized while providing this e-nursing, and the regulatory organizations will be less. The profession as a whole, both nationally and internationally, we can utilize the timing as well as the service. Okay, so these are the benefits through tele-nursing and e-nursing. To conclude, nowadays, so as I said, the change is more important. According to the technology, according to the time, we have to change and provide the care for the patients. Thank you. So if you have any questions to me, you can ask me. I thank the organizers to provide opportunity, but sorry for this inconvenience of technology here.
I'm extremely happy to welcome Ms. Aruna G, Associate Professor, Department of Obstetrics and Gynecological Nursing, Sri Narayana Nursing College. She is a learner in teaching nursing students. She has completed her Masters in Obstetrics and Gynecology Nursing from Narayana College of Nursing, Nellore, affiliated to the Dr. India University of Health Sciences, Vijayawada. She is pursuing PhD in nursing at Lincoln University College, Malaysia. She is having more than 9 years experience in teaching, currently working as Associate Professor in Obstetrics and Gynecological Nursing Department, Sri Narayana Nursing College, Nellore. She has presented research papers and poster presentations at national and international conferences, workshops, and Indian Science Congress. She won the first Best Poster Presentation Award, Current Status and Future Prospects in Life Science Research, Dravidian University, Kuppam, India. With equal pleasure, I invite ma'am to present regarding the topic tele-surgery and tele-nursing.
Good evening, Varada, who gathered here, and thank you very much for giving this opportunity. Now, I am presenting a tele-surgery and tele-medicine. The surgery is the able to do the doctor, and the doctor or the physician will be performing the surgery on patient, even though they are not physically in the same place. It is a form of the presence, means the robotic system generally consists one or more arms. Okay, these will be controlled. The arms will be robotic arms will be controlled by the surgeon, and for this a master controller will be there. He is called as master controller, and sensory system giving feedback for the sensory organs, and remote system is having the elements like a robotics, telecommunication, such as high speed of data connections will be necessary. So tele-surgery, it is an emerging surgical tool, and it will be utilizes both the robotic technology and wireless networking to connect the patients and surgeons who are geographically distant. So the tele-surgery harness a form of network-mediated robotic control. So coming to the tele-surgery, the word came from the Greek, which means remote. Chair means hands. Many arms will be there to doing of the surgeries or assessing for the surgery. And action means to work. Coming to the tele-surgery and robotic, so here the improved and efficient eras, what are the past, future, and present, what is happening, we'll see. So this concept of tele-surgery, the distance between the surgeon and the patient is not a new idea. Previously, 1970s and 59 onwards, the surgeries is going on. How it can be explored means by the National Aeronautics and Space Administration, that means NASA, which had a particular interest in this, providing the treatment in aeronautics in space based on the concept of remote surgery or the tele-surgery. This simultaneously advantages of this robotic surgery made possible for doing of the surgeons. So the first tele-robotic surgery was successfully performed on the patient in Strasbourg, France by Professor Jacques Mascus on September 7, 2001. So which was called the Lindbergh operation. The surgery name was Lindbergh's operation. It was tele-surgery and it was assisted cholecystectomy, which was completed in 54 minutes without any complications. So for this doing of this surgery, they have used fiber optic service provided the link between the robotic system and the surgeon. The surgical procedure was named by Operation Lindbergh in honor of the Charles Lindbergh, the aviator who made the first non-stop flight across the Atlantic in 1927, was a milestone in modern medicine and represented the beginning of era. Coming to the
future of surgery is transforming with investigation of new technologies such as, so here mainly 6 types of the technologies is necessary, that is fifth generation of the network and internet, artificial intelligence, haptic feedback technology, 3-dimensional printing and nanotechnology is necessary for doing of the surgery. And in 2019, tele-robotics spinal surgeries based on the 5G network, they performed on 12 patients in 6 hospitals from 6 different cities in China. So here they used 59 screws for gas bend Robbins criteria, and 3 screws was used by B. So far they did the pattern of 1 to many arms. Other remote surgeries was also explored with these clinical services, where the surgeon in the master control room was providing surgical care to the patients who were physically isolated ones. So these cases, 12 cases have shown possible and provided the minimal latency and with the minimum reducing of the risk infections, and there is no telecommunication errors or the network delay. Coming to the benefits of telesurgery, eliminating the long distance travel and providing the healthcare to medically unreserved areas and surgical collaborations, improving surgical accuracy, eliminate potential shortage of surgeons, minimizing the risk of infection. So eliminating the long distance travels, traveling for the any medical restrictions or the feasible option may not be there because of any financial constraints or the travel related problems and travel restrictions are delaying of the time. Because of this, they are eliminating the long distance and providing healthcare to medically undeserved areas. Here, the telesurgery is providing the surgical care to the people worldwide, especially if there are areas such as remote areas or the rural areas, battlefield and accessible areas, and they are providing the health care through the robotic system. And surgical collaborations, the collaboration between the different surgical experts or the various healthcare centers will be there. From those areas, the patients can also get the benefit and improving the surgical accuracy. In this, they are using 3D cameras. 3D cameras, why? Because to close up the views and small areas in the body of like a bladder and the pelvis areas and the clear view will be there, clear picture will be there. With that robotic arms, they will be assisting and improving the surgical accuracy and eliminate potential shortage of the surgeons. There is a global shortage of the surgeons and anesthetists. And next, coming to the minimizing of the risk of infection. So during the COVID time also, we used telemedicine and tele-nursing, telecommunication. So in this, there is a surgical interventions also where the critical situation or the critical interventions will be there, where we are using this robotic system to reducing of the risk of viral infections. And it's coming to the limitations of telesurgery. So the limitations of global network development, legal issues, billing costs, cyber security threats, and high speed of network. Coming to global network development, to make telesurgery successful, a feasible option of anyone in the world, so there is need to develop a good global network. So when we are developing the good network that allows the patient in anywhere, they can get the treatment in anywhere of the world. And legal issues, the concept of getting this medical care from the surgeons, there is no real interaction. They will be getting the information to the tele information only. So for that, many ethical issues will be arising, laws differs across the state and the country borders. Then billing issues. So here the surgeries will be doing by the various surgeons and various medical centers will be there. So all the medical centers will be collaborate with the telesurgery. And so for that, billing issues will be arising and cyber security threats also will be there. Because of this, the cyber attacks against the teleoperated surgical robots, these robotic computer systems have the possibility of being
taken over and even being turned into the weapon which can be potentially harmful. And they will be using of the high speed of 5G network. With this, incorporation are to providing the more advanced of the robotic technology enable more complicated procedures to take place, allowing the surgeons to control different robotic arms. Push button will be there to command the robotic device and communicate with each other. At present, we are using the Da Vinci surgical system by Innovators Surgicals. This leading to the company in the field of tele-surgery providing greater than 210 devices. The company gained Food and Drug Administration approval in July 2000 to perform the advanced surgical techniques. And other surgical systems like it will be allowed the surgeon to operate while seated, and the surgeon will be consoled at remote distance and viewing with the 3D images of the surgical field. The surgeon can use the master control by grasping their fingers below the display. So they are using the Da Vinci system provides 3 or 4 robotic arms to do the endoscope, and 2 or 3 instrument arms carry the commands of the surgeons. With this, they are doing the surgery. These are all the equipments they will be using and doing the surgery. And key component high resolution visual system is necessary for that form of an endoscope with a high resolution image processing equipment to produce 3D images of the operative field. Telesensors such as cyber gloves contain highly sensitive technology placed at critical points to pick up and measure the posture of the hands. And the operator measuring changes in resistance to an electrical current as the sensor is bent as the surgeons move their hands, and haptic feedback technology they will be using, which will be enables the tactile feedback and allowing the surgeon to feel the tensile strain, section, and depth of the tissue from the remote system. And it's coming to the telemedicine. According to the WHO definition, the telemedicine delivery of the healthcare services where a distance is critical factor by all healthcare professionals using the information and communication technologies for the exchange of valuable information for the diagnosis, treatment, and prevention of the diseases, injuries, research and evaluation, and for the continuing education of healthcare providers, all the interest of advancing the healthcare individuals and their communities. So, telemedicine, how it came to the India means one of the oldest known telecardiology system for the teletransmission of ECG was established by Gwalior, India in 1975 at the GR Medical College, and the first Ayurveda telemedicine center was established in India 2007 by Pratap Chahun, director of Jiva Ayurveda. They introduced the telemedicine in India. And what are the aims of the telemedicine is deliver the specialized medical care and advance with the advice with the reach of the patients and distant levels of the distance of the places. And now coming to the objectives, it will be provides specialized medical advices and monitor the patient conditions, guide other medical staff about the treatment procedures, diagnosis, and prevention, and share the patient data among the institution for the research purpose. And types of telemedicine, we are using many devices types to be using, that is interactive telemedicine services,
specialist and primary care consultations, store and forward telemedicine, remote monitoring, imaging services, LCD monitor, ECG machines, digital cameras will be using, digital microscope scanners, desktops is available for providing of essential equipment and all. In coming to the conclusion, the robotic surgery can be demonstrate a vital role in the surgical processes being performance in the current pandemic by minimizing the number of surgical staff in the operation theaters, hence curtailing the risk of COVID-19 infection that can subsequently lead to the profound morbidity and mortality rate. Thank you. Thank you for giving this opportunity. If there are any queries, you can come forward and ask the queries. It was a very good and interesting question indeed. Thank you very much for the. Thank you so much for Aruna, and she has explained about the history of tele-nursing. Thank you so much. Next, I take the privilege of welcoming Associate Professor K. Kanta, Department of Community Health Nursing, Narayana College of Nursing. She is a research scholar at Pondicherry University, working as an associate professor in Community Health Nursing Department in Narayana College of Nursing and Deputy Nursing Superintendent at Narayana Medical College and Hospitals, Chitaradupadan, Nellore. She is working from 2012 to till date and involved in clinical education needs as per curriculum. She taught UG, postgraduate and actively involved in research activities with 68 original research publications, 8 book chapter publications. She is having to her credit 135 Google Scholar citations, 7 H-index, 4 I-10 index, and she is involved in all evaluation aspects. She had an extensive experience in outreach and public health orientation programs, participated in many national and international conferences, and presented oral and poster presentations. She is a member secretary for Ethical Committee, which is approved by the Central Drug Standards Control Organization. Madam has organized 2 funded national conferences approved by ICMR. Then currently, Madam is working as the Deputy Nursing Superintendent in Narayana Medical College and Hospital. I extend my warm welcome to present the topic on digital therapeutics.
Thank you so much, Ms. Subhashini, for the great intro. Respected judges, respected observer madam, dear colleagues and loved students, a very great good evening. Good evening, all of you. All are here? Both mentally and physically? Do you promise with me that? No, madam. What, madam? So be with me physically as well as mentally. I will be taking you to the digital world. So I know very well that all you are very busy with your digital mobile. Yes or no? No, madam. No, I am very happy you are listening to the class. Okay. So we know very well that the present world is heading forward with digitalization. Yes or no? For anything, okay, Google Pay. If you want to check your health status, okay, you will be wearing the wearables, okay, the watches, okay, the modern watches, okay, which will be saying you by this time how many steps you put. By this minute, what is your blood pressure? By this second, what is your blood glucose or pulse rate or respiratory rate? Okay, everything will be checked by the digitalized apparatus. Okay, like we could able to say that the present world is a digitalized world. Do you agree with me? Okay, so let me go to the presentation. So here, today now we will be discussing regarding digital therapeutics. See, we have taken profession, health profession, and in that nursing profession. So being a great nurses, we have to know, like we have to go along with the digitalized world. Do you agree with me? So you have to concentrate on this session. So what is this digital therapeutic? And so in our nursing profession, like if you are getting or if you are seeing or if you are applying or implementing this digital therapeutic, we have to know what it is. Okay, in order to educate to the patient properly and promptly. Okay. So here, let me see regarding digital therapeutic. So what is this digital therapeutic? So digital therapeutics means a treatment or therapy that uses digital. Okay, so the meaning is so simple. In the name itself there is meaning. Okay, digital therapeutics means what here? Any therapy or treatment which utilizes digital mode is called as digital therapeutic. Okay, so let me say this statement. So digital therapeutics means evidence-based therapeutic interventions driven by high-quality software programs. See, so far we have discussed like right now you will be knowing, like you could able to know what is your blood pressure, what is your pulse rate, okay, what is your blood sugar, like how it is through the digitalized world. Okay, like if you are using any gadget like that. Okay, so that means like any software program if you are using in order to know the health status. Okay, so that is digital therapeutic. Okay, so for what it can be used, this digital therapeutics can be used to prevent, manage or treat a medical disorder or disease. Okay, so for what reason we will be using? See, in the present situation, maintenance of health is just like it is like that. Okay, but here, so at this current moment, we have to focus on the health promotion. Okay, so health promotion means what here? Above the normal life. Okay, now it's not the health maintenance. It's just above the health. Okay, normal health. Okay, that is health promotion. Okay, so for that, we have to follow the digital therapeutics. See, the emerging research and cutting-edge therapies indicate promising use of digital therapeutics for digital diagnosis and treatment. Okay, so now the present world if you are taking, so the emerging research is focusing more on this digital therapeutics. Okay, so what is this digital health explosion? Okay, so I think till now, Ms. Namita Kumari Madam told regarding e-health, okay, or e-nursing, okay, tele-health or tele-nursing. Okay, it is the tele-health is also a part of this digital health. Okay, so what is this digital health explosion? It includes M-health. What is M-health? Mobile health, telemedicine or telehealth, smart devices, sensors, wearables, health IT, personalized medicine, RWE studies. What is this RWE? Real world education. What does that mean? At present, okay, really, what we could able to see, what we could able to utilize will be coming under this RWE studies. Okay, so all these things will be coming under digital health. Okay, so when we talk about digital therapeutic, three terms we have to remember. What are those? Digital health, digital medicine, digital therapeutic. What is this digital health? It includes various platforms and systems that apply technological solutions to enhance healthcare delivery. Okay, so that means what? Digital health is part here. So what are the solutions of the software programs we are utilizing to promote the health? Okay, so that is digital health. What is digital medicine? Digital medicine means in the name itself there is meaning. Medicine means what? Any product that can be used, okay, in order to maintain or to render the treatment or to monitor the health status. Okay, so that is digital medicine. Then digital therapeutic. What is digital therapeutic? It provides evidence-based software-driven therapeutic interventions that prevent, manage, and treat a medical disorder. Okay, so try to understand all these three terms are very different. Okay, very different in nature. Digital health is, it is a situation where we will be using or utilizing different platforms. Digital medicine means any product can be utilized. Digital therapeutics means it is the mode how we are able to treat or prevent the disease. Next, if you look at the history of digital therapeutics, actually in 1995, technology-driven care by Joseph Medar was invented this one. Okay, in 1999, term e-patient was coined by Dr. Tom Farragut. 2000 publications based on digital products were came into existence. And in 2001, formal use of the term DTX, okay, so that is digital therapeutics came into existence. So, what is this digital therapeutic alliance or DTA? See, it defines digital therapeutics as delivering evidence-based therapeutic interventions to patients that are driven by software to prevent, manage, or treat a medical disorder or disease. So it is used independently or in concert with medications, devices, or other therapies to optimize patient care and health outcomes. Products are reviewed and approved by regulators to supplement the product claims regarding risk, efficacy, and intended use. Okay, so that means through these digitalized products, we could able to clinically validate the products. Okay, we could able to see or evaluate the action in a rigorous manner. Okay, and we could able to focus on a single point. Okay, how does this digital therapeutics will be working means? Like we could able to see the change in the patient behavior. Like previously, what is the blood glucose levels? Okay, and after using this digital therapeutics, what are the levels of blood glucose levels in the diabetic patient? We could able to assess. Next, remote patient monitoring. Remote patient monitoring means what? So the patient can be present in the home, but the doctor will be able to see the health status of the patient from the hospital. Saves the clinician's time. So adds value to the traditional healthcare delivery system also. So here the disease management versus digital therapeutics. So what are the things will be coming under here? See, we can able to concentrate on chronic diseases. So the chronic diseases like stroke are the non-communicable diseases, neurological disorders, substance addiction, medication adherence. Digital therapeutics in the post-COVID era. Of course, from the year 2020, so as the COVID emerged in the world, so this pandemic affected many individuals. Okay, so many individuals' health status was affected due to the non-availability of the many healthcare personnel directly. But from that time, this digital world or digital health helped many patients like teleconsultation, remote patient monitoring, and improving patient adherence, cloud-based patient data management, site-less clinical trials. So how did digital therapeutic market boom in post-COVID era? So here, like usually any intervention or any new innovation which is coming under this digital therapeutic, it will be approved first by the FDA. Okay, so it needs to have lots of clearances. Like it will be tested by over the pilot samples. Okay, then it will be bringing into the real world. So large scale applications of digital therapeutic for pharma investments into digital therapeutic, pharma co-development, the foundation of digital therapeutic specific society will be formed. So here, the digital therapeutics and the patient healthcare journey, it will go like this, like the preventative care and wellness. For example, prevent the onset of diseases like heart diseases. Okay. Or it will be helping for diagnosis, like it provides diagnostic information like breast cancer, or treatment decision, like for example, make decision on treatment regimens that improve clinical outcomes for the diabetic patients, or treatment act as standalone treatment with the proven clinical efficacy and complement existing treatments by enhancing clinical outcomes. Like for example, ADHD. What is ADHD? What is ADHD? No third year? No fourth year? What is ADHD? Yes, someone is telling. Attention deficit hyperactivity disorder. Yes. Okay. So like that condition, because for the caretakers it will be so much burden for them. Okay. So for these cases, next high risk care management, like allow patients and healthcare professionals to monitor and track symptoms to continually refine and optimize treatment regimen. So that means even in rendering treatment, there will not be any delay to the patient. Okay. So here, why we have to choose or go for this digital therapeutics means it empowers consumers to make better informed decisions about their own health, provide new options for facilitating prevention, management of chronic conditions outside of traditional care setting, early diagnosis of life-threatening diseases, represent the pinnacle of customized tech-based healthcare delivery. Okay, so mainly for these 5 purposes we will be going or opting for this digital therapeutics. See here, we could able to see an example of digital therapeutic in the market or under development, like basal insulin dose calculator for adults with type 2 diabetes. Like what is the blood glucose level? Okay, like 250 mg per dl. Okay, so to that glucose level, so what is the amount of insulin can be given? Okay, so that will be, so that instrument will calculate it automatically. Okay, next neurological music therapy to address our motor, speech and cognitive dysfunction caused by neurological disease of the injury. Like for example, any patient is suffering with any neurological disorder, to enhance the CNS, okay, central nervous system. So what type of raga, like for example, Mohana raga, like that. So that instrument will play that music in order to enhance the cognitive behavior of the individual. Next, intervention tool to train cognition in the concussion patients as said before. Combine software and hardware program to improve asthma and COPD control and optimize healthcare utilization. Digital therapeutics utilizing adaptive sensory stimulus software for the treatment of ADHD delivered through an engaging video game experience. AI-based digital diagnostics and personalized therapeutics for pediatric behavioral healthcare. So like here some of the examples they have quoted, and all these digital therapeutic equipment is under trial. The digital therapeutics empower patients, healthcare providers, and payers with intelligent and accessible tools for addressing a wide range of conditions through high quality, safe, and effective data-driven intervention. So here, through this, a big help. What is this big help? Helping millions back to good mental health. Okay, so mental health is a 24-hour problem. So here the digital health, even it decides the amount of light, okay, that has to be rendered in the room. Okay, so during the night, okay, the CPO mode, okay, in the daylight mode, okay, which adjusts that we could able to see. Even in some movies, when some persons are entering into the room, automatically the lights will be on. Okay, when they are going away, automatically the lights will be off. Okay, like that. So the Click Therapeutics, it is developing and commercializing the software as prescription medical treatment for people with unmet medical needs. And see here, why I am keeping this slide. So there are so many companies like Volunteers, Propeller, Amigo, Agili. So these are the different companies. Okay, so which is producing the digital therapeutics. So what are the barriers in the adoption to digital therapeutics? So difficulty in distinguishing digital therapeutics from the more general health and well-being applications in the general digital health market, increase in physicians burden by data overload, difficult to separate unproven or low-value applications, reimbursement decisions are the digital therapy. Okay, so that means, so here, so far, even in India, the digital therapeutics are not fully implemented. Why? Because due to the commercial reasons, because they are high costly, and even the pilot projects are going on, but they were not yet fully implemented in the common public. So what is the future of this digital therapeutics? Is reforming the landscape for new medicine. So it can significantly influence the healthcare delivery. It can impact the product reimbursement process, emergence of new data sharing processes, insertion of new payment models can be done. So regulatory aspects of DTX. So the US FDA considers digital therapeutics to be mobile medical applications. So applications helping patients organize and track their health information. Applications providing easy access to information related to conditions or treatments. Applications helping patients self-manage their disease or condition. Example, wellness applications without providing specific treatment. No specific methodology to evaluate the companies formally as yet. Digital Therapeutics Incorporation guidance by other regulators. So the National Institute of Health and Care Excellence, together with NHS England and NHS Digital in the UK, is trying way to accelerate the uptake of digital innovation. So Academy of Managed Care Pharmacy has also set some guidelines for entities to qualify this digital therapeutics. Okay, next coming to the R&D. What is R&D? Research and development. So the digital transformation in healthcare, as stated previously, it was started from the 1995. Okay, so here till today, till 2020, it is going on. So the digital transformation in healthcare, why? Because we are having more aging population. Patient census are increasing. Chronic diseases are increasing in number. Okay, so in order to manage all these increased numbers, digital technologies are needed. So as we discussed earlier, so the digital health, digital medicine and digital therapeutics will be helping to deal with the current situation. So what is the vision for this? The digital therapeutic standalone, add-on or combo are the first therapeutic option offered by the physicians to patients with chronic diseases of the dependent. See, even in the R&D, so the digital therapeutics are therapeutic interventions designed to modify behavior, developed through RCT, approved by the regulatory bodies, reimbursed by the NHS, prescribed by the physician or the active ingredients. So how we could able to modify the behavior? By providing the simple information or by giving the motivation. So here this digital therapeutics. So through the apps, okay, it will be like starting like startup, like it can be used for major depressive disorder, generalized anxiety disorder, insomnia, ADHD, autism, eating disorder, schizophrenia, dependence, smoking cessation, type 2 diabetes, obesity, asthma, COPD, and oncology. Okay. So here they will be having a process to qualify the software to select for the digital therapeutics, like therapeutic intervention, digitally delivered, digitally active ingredient, physician dashboard, digital experience, and delivery platform. So these are the therapeutic intervention, software development, and so here as I said, so this digital therapeutics, first they will be conducting the pilot clinical development. So the clinical test, usability and acceptability, like or for example, 50 volunteers with or without the disease, pilot clinical study to assess efficacy and safety, confirmatory clinical trial design. So what is the use of this clinical trial is combo development, digital therapeutic plus drug. Okay, it will be more than a normal drug. Okay, so that we need to understand. So here in the pre-clinical phase, like it will go like research, software development, pilot clinical development. So once it is getting approved through the pilot study, so then it will be going to the clinical phase, like full clinical development. So as we have seen in the previous slide, so the NHS, insurance and the patient will be paying for this digital therapeutics. Okay, so barriers, so as we have seen, so it is having even the R&D component is having the barrier like difficulty in distinguishing, increasing in the physician's burden, difficulty to separate the unproven or the low value application, reimbursement decision for digital therapy. So coming to the conclusion, digital therapeutics are here to stay. Okay, like here, I think many mobiles are using digital therapeutic apps. Okay, or the software programs. Okay, so next, ready to address chronic or other difficult to treat conditions, expected to significantly influence healthcare delivery, have the potential to change what pharmaceutical industry sells. Pharmaceutical companies are taking thoughtful approach to digital therapeutic. US FDA and NHS are also recognizing the potential digital therapeutic. Big investments are happening in the digital therapeutic field. Soft skills are essential to bring about effective regulatory changes in the digital therapeutics. Like here, the more good will happen, but for the digital therapeutic, so the like it is even still at the pilot study stage itself. Okay, it has to come to the real world programming. Okay, then only the common man like us would able to utilize this digital therapeutics. Thank you for the opportunity.
Thank you for the excellent session, ma'am, about this digital therapeutics. Ma'am has explained in detail about the research-based digital therapeutics. So thank you so much for the opportunity to take part in this session. Thank you.
Thank you very much, ma'am, Kanta ma'am. Now let us go for the next session. I would like to welcome Dr. S. Vasanta Kumari ma'am, Associate Professor, Department of Medical Pediatric and Neonatal Nursing, Institute of Health, Olega University, Ethiopia. She has completed her master's in she finished her master's in pediatric nursing from Omailati College of Nursing, and she has 24 years of experience, including clinical and administrative experiences. She has completed additional courses in the child care education and PG diploma in educational management and supervision, and certification courses on intellectual specialty, and also obtained many certificates for attending training and on faculty development programs. She is doing funded research work on a community services, and she has a life membership in different international and national professional organizations. She has published more than 50 scientific papers and review articles and in the index journals, and one patent field in a field of 2 in India and 1 in German. She has been the resource speaker, scientific paper presenter, and a poster presenter for many national and international conferences. So, she is a reviewer for the editorial number, and for the index journals, she is a reviewer. She is also an author for many nursing books. So, to add on to her credits, she achieved many awards, and the Best Professor, Outstanding Scientific Awards, and the International and National Professional Organization paper presentations, and presently she holds a post of Nation President of this Ethiopia region, Vice President with the Special Minds. So with all these conferences and oral presentations, webinars, she has many more achievements in her career. So over to you, ma'am, and call upon for the presentation.
Thank you so much for the kind introduction, and I hope I'm audible for you all. Am I audible? Sorry, because I'm actually at home today. I'm not in the university. Today is an off day for us. I cannot go to the university today. So that's why I'm a little bit apprehensive, because sitting and doing at home is not very easy, comfortable than doing in the university. Anyhow, I think you will apologize me if there is any deficiencies. Thank you so much for the opportunity. So let me go on to the presentation.
Can you share your screen from your side, ma'am?
Yes, dear, I'm doing that. I'm doing it. Is it visible?
Yes, ma'am.
Okay, thank you so much. So let me all welcome you all. I think once again, I'm welcoming you all for the 5th International Conference on Futuristic Nursing, a very beautiful topic, which is that is navigating beyond the horizon. And really, I'm thankful to the management, dean and HOD of my own university for giving always constant cooperation and support. As well as I'm very much thankful, and I'm owing my acknowledgement to management, dean, principal, vice principal, HODs and organizers of esteemed Narayana College of Nursing, Nellore, India. I think this is the 3rd time I'm again resource speaker for the esteemed Narayana College of Nursing. I'm very much thankful to Indra madam and the team, and also I'm acknowledging SFNP for a great endeavor. So the keynote speech mainly is going to be on the physical to digital. So here I'm going to talk about the electronic software that is for the nursing documentation. So we all know very well, without electronics, nothing is possible now. So when we are going to go, I think if you go alone, even without carrying a money also, it's no problem. But without carrying mobile, nobody is able to go out. So we are very much dependent, techno-dependent. So no, as we are techno-dependent, we need to become techno-savvy too. So coming to the introduction part, today's healthcare is becoming increasingly complex as hospitals incorporate the technology mainly to assist the nursing professionals and other providers to deliver high quality patient care, which is very, very important. And we need to be very efficient and very ethical in providing this patient care. And digitally connected health services environment is very, very essential tools mainly to empower the nursing professionals in the present era. So coming to the nursing documentation, we all know very well it is the process of maintaining the records of nursing interventions that are planned and that has been implemented for every patient by the nurses. So it is very crucial facets of nursing decision making in the care practice scenario, and it is going to be a critical aspect of nursing care workflow also when we are going to manage the work. So the healthcare environment is continuously changing and evolving, and nurses are making a very great strides mainly to adapt to these changes in an attempt to meet the complex healthcare demands which is being put forth. And there is a crucial development in the operation of nursing practice, which is happening in present era. We are being expected more. And so most health systems and organizations will move towards the electronic documentation primarily or exclusively. And this increasing shift towards the documentation has become a very important implications for documentation practices as well as for providing the care among the nursing professionals. So when we talk about the electronic documentation, the transition is happening mainly because of the technological changes, and it has become a very significant implication for all the nursing profession and also for the overall healthcare system to go for this adoption. So this method of documentation for the nursing professionals is very, very important because we need to address the problems that they are facing because of the paper-based documentation. So it has a lot of advantages over this paper-based documentation. So coming to the electronic documentation. So healthcare industry, when we see it is mainly attempting to employ the electronic documentation mainly for the purpose of clinical practice, research, education, as well as supervision. So the nursing information system, we all know very well, the informatics, it's mainly controlling the nursing care services. It is helping to manage the nursing activities mainly through the data that has been assembled. We are going to exchange the data, store the data, extract the data, and also presenting the data whenever it is required. And also we can transfer the data when it is required. So here the electronic documentation is, or we call it as a charting, is the norm in an increasing number of healthcare facilities, and is very important essential tool mainly to provide a safe and high quality care. So this is according to Agency for Healthcare Research and Quality, which they have given in 2018. So this electronic nursing documentation, we all know, we can call it as a computerized documentation or computer-based documentation, and which is called as electronic information system used by the nurses and other healthcare professionals, mainly for the purpose of systematically documenting the clinical information that is pertinent to the health of the individual, to the clients. So here, when we talk about this particular documentation, there is certain composition, because when we talk about the software, what we use for this documentation, it has to have some certain functionality, it has to have a certain looks, it has to have certain feel, and also usability. It's very, very, very important in terms of this. So some healthcare organizations are mostly, we can see they are building their own electronic software systems. For example, electronic patient record system has been built by Ontario, Canada, and also there is also many other countries also which is coming up with all this type of software systems. So they are the digitalized version of the paper charts. So they can completely include the information mainly similar to the paper charts that is being collected by the paper or paper documentation. Completely it is being transformed to the digital transformation. So here, when we talk about the compositions, it also should contain the structure of the document that is going to have mainly it has to follow the nursing process, and also it has to have certain standard terminologies. Mainly these terminologies are very, very important because they are going to describe the phases of the nursing process. When we talk about the information, what all it has to have, what information the nursing documentation, the electronic software should contain. Mainly it has to have the assessment data, it has to have the medication orders. Hello, am I audible? Am I audible? Hello?
Audible.
Hello?
Yes, you
am
are.
I audible? Okay. Thank
you
you
are.
very much. Okay, thank you. There was certain disturbances, that's why I had a doubt. Okay. So that mostly it has to have assessment data, because we all know SOAP format. We all follow this. We are all having the SOAP format. So always we need to go with this assessment data, subjective and objective, medication orders, therapeutic orders, and clinical intervention. I think Dr. Kata, madam, she has spoken about the digital therapeutics. So that is those orders also should come into this. And clinical interventions, care plans, progress notes, consults, any consultation or any referrals, then nursing histories, diagnostic and lab data, and client outcomes. So these are the components which is very, very important in the software we have to include. So it has to integrate, mostly we can say it has to integrate with the supplementation of the electronic software. Whatever software we are going to have, mostly we have to bring into that, and it has to automate the creation, it has to generate the documents, forms, and necessary templates that is to be required. So also these complete documentation, what a nurse is going to use or the nursing professional is going to use, it has to be leveraged by physicians. They have to use other medical administrative faculties also should use, also even the healthcare insurance providers, because that is very, very important. Nowadays, healthcare insurance providers are going only with the technology. So everything should be fed in this. So nurses should be very techno expert in feeding, and they have to completely, they should be able to store data and retrieve the data in the future course too. So it has to be very much sophisticated. It has to utilize artificial intelligence. So I think even a previous speaker was talking about the robotics. So artificial intelligence is very, very important, which is going to creating a lot of revolution in the healthcare field. So that is mainly used as a support system that is going to take up the data-driven clinical decision making, which has been incorporated into the electronic software that has been used for nursing documentation. So the data that is being documented, mainly we have to build algorithms, and we have to predict the future outcomes like risk. Also, they can predict certain things like warnings, alerts, or any guidance for the healthcare providers, mainly for the purpose of providing the care. And it has to uphold the integrity of the records, and it has to facilitate a clinical pathway. So we all know very well, whenever the patient is admitted, the clinical pathway is very, very important, especially if they go for the surgeries. So similarly, the clinical pathways also, it has to have a workflow standards. So this is very helpful for the planning, and it is also very helpful for the nursing people to completely manage their work. And standardized templates should be there, customized computer screens and drop-down menus guides should be very available for the documentation process, because if anybody who is going to work, we are going to work across the globe. Nobody's working. For example, when we are getting educated in India, we are not staying in India. We are going to go to other countries. Like we may go to USA, we may go to Middle East countries, we may go to other countries where we go and work. So in this case, when we are going to work, we should be having a standard templates, which is going to be helpful for anybody who is across the globe. So this is going to be a standard one. And this will be helping the nurses to completely enter the pertinent information, whatever pertinent to the patient. And coming to the popular types of software that is being used, electronic patient record software, electronic medical record software, medical database software, medical research software, medical diagnosis software, and medical imaging software, e-prescribing software, telemedicine software, and also appointment software, because this is when a patient is going to come, he will fix an appointment, he is going for a booking, even that is all, there is a software even for that. And medical billing software, hospital management software, medical equipment management software, health tracking apps. So whatever, so I think nowadays everybody is having a smartwatch, so which is going to go for health tracking. So everybody should have this, and everybody should be oriented with this. And personal health record software. So these are the things which is very, very important, and that is especially they should have a medical diaries. Also, when we talk about the systems, whatever we are going to use, the clinical documentation is mainly, increasingly it's being recorded. Mostly partially or completely it has to be recorded by the electronic documentation system. And what it has to use for recording, surely we have to have a computerized device such as desktop, computer, laptop, or tablets, or sometimes even smartphone also can be used to record this data. And also the skills. What are the major competency, practice competency a nursing professional should have? Data entry, data viewing, data extraction, and exchange of the various types of client information. So mostly we need to even transfer the information to someone when it is to be shared. So what are the features? Mostly it has to identify who enters the data, who is going to maintain the data, and it has to be very careful with the restriction, because we need to restrict to the system, because who enters the system, who is going to browse the system, who is going to view the system, because we have to maintain the confidentiality. Ethical principle is very, very important. So we cannot completely openly access this to everybody. Also support the clinical data exchange. So we have to know the login ID, password, everything should be maintained. And also there should be adherence to a compliance regulation should be there. And also we have to move to this is mainly a paperless office or paperless practice. I think everybody is going for the paperless work. So this is going to become a paperless one. So ease of use and quality of support is a very greatest features what we can see in this. So what is ease of use? We can use it very easily, and also quality of support is very good, because when the support is given, digital transformation is very, very easy for everybody, because anywhere you can carry, anywhere you can go, anywhere you can sit and you can browse. In telenursing, if you see, we know. And here, when we talk about the ease of use, they found a study, they found out 8.3 out of 10 on average is telling about this. And similarly, 8.3 out of 10 on average, they say that quality of support is very important. So coming to the healthcare systems, what are the documentation which is popular? Electronic medical records. We all know very well that is being used by the physician, and electronic health records, which can be used by all the health professionals. So when we talk about the electronic medical records, mostly we can say it has been built for a single organization or practice only, and mainly it is focusing on the medical data and specific to the physicians. Whereas when you talk about a health electronic health records, which is interoperable, it can be done as a interoperable. Everybody can operate, because everybody can leverage. All providers who are going to be in the healthcare system can access and exchange the information across the organization as well as the providers. So here we can have two types of components of the electronic software. It can be structured or it can be unstructured. So what is structured? Structured, if you see, it is mostly a structured data elements. If we talk about that, it is going to be something where we can see the data is entered properly. It can be viewed, it can be analyzed, it can be completely fed. So the completeness will be there in structured. Whereas unstructured, it is not going to be very complete. For example, you can only upload an image file, or we can upload only a video file, or anything which is only required. So it is not going to have a complete document. So here, the purpose and vision of this particular electronic software for nursing documentation is mainly the aim. We can see it is to facilitate the seamless care for the clients, mainly by providing a way to capture and access the real-time client data. And purpose is mainly scientifically, we have to reduce the amount of the clinical nursing report data collected and documented by the nurses, because nurses are not having time. They have to take care of many work. They have to do many work. So to manage the work, it's mainly very important, because during the patient care process, they can easily they can enjoy the nursing care only by concentrating on the quality of care if they are going to go for the easy documentation. This documentation burden will be reduced. So also it is helping to eliminate the gaps in the care that can arise from the inability to share any information across the institution or any geographic boundaries. They can do this very easily. So today I'm sitting in Ethiopia and I'm presenting info to other, I'm presenting to our esteemed Narayana as well as SFNP, and I can see the students and watching this. And this is mainly because of this particular technology. Similarly, we can assess the longitudinal and comprehensive health records of the clients along with the documentation. Also, we can use the clinical tools to support the care provision by the individual healthcare providers and the team only due to this electronic software. So it has three. I said there is a CNO. CNO is mainly on assessment, clinical assessment, and also it is going to go with the nursing implementation and outcome. So what they say, there are three standard elements very, very important for the principles of documentation. So we have to see it should have a complete communication, and the person who is responsible should be accountable for that. And it has to have a security is very, very important, because it should not be a risky one, because privacy should not have any breach in the privacy. So security should be maintained in this case. So advantages, mainly if you see, nurses can update the information at the point of care rapidly. Also, the data can be accessed equivalent to what nurses can see when they are going for the rounds. Nurses can coordinate, communicate, and collaborate with other team members. And also very easily, they can have a transfer of information. Also, it is helping to learn a standardized nursing terminology, because everybody will have a standard terminology, standard captions will be there. Similarly, it will reduce the errors like medication errors, life-threatening allergies. We can have an alert. Also, it can spot abnormal lab values, because there will be alert for this. Also, it is very important for the preventative and treatment services and better outcomes. Coming to the standard, it is going to improve the standard and comprehensiveness of nursing documentation, and also it is going to improve the professional satisfaction of the nursing personnel. And precision, timeliness, concurrency, conciseness, organization and confidentiality, as well as accuracy is very, very much in this. Also, it can save the time and resources and allow the faculty mainly to, nursing professional mainly to focus on the efficient, effective, and safe patient care. It is also increasing the safety of the healthcare services. Accountability will be increased, and it will facilitate the communication between the healthcare stakeholders also, because stakeholders are very, very important, who is going to completely implement everything ultimately. And legibility is very important, because sometimes when we are going the paperwork, the legibility of the paperwork will be questionable. So that legibility can be done it here, because when you are documenting, it will be very clear. Clarity is there, and you don't have any incompleteness will be reduced. And also when the paper work is reduced and the staff turnover staffs are very completely, they can concentrate on the quality of care, and their work burden is reduced, and the staff turnover also can be reduced, and legal problems, because mainly the data incompleteness can cause a legal issues. So those things also can be curtailed. Also, the quality can be improved, more complete and more patient-centric data documentation will be done. Also, when you talk about the health centers, hospitals are more benefited because they can have the that is the changes, the way of maintaining records will be done, and there will be an excellent option to have administrative expenditures, because they can reduce the administrative expenditures by paper will be reduced, and also the turnover is less, and the staff turnover is less. Staffs are given they are focusing on the quality of care. So the improvement of the hospital quality is also improved. So the outcome of the client is improved. So in every way, there is advantage for the health centers. So they are going to validate the information and accept only the trusted sources that is being approved. So that is very, very important. Also, it can give a safe, ethical, and effective nursing care and address the workflow issues. So it can manage the workflow and reduce the documentation. We all know very well, mostly the problems, because documentation is a very, very important problem, where because of the documentation, the people are leaving the work. They will leave the things and they will be documenting. So those things could be read, and also anytime the data can be retrieved whenever it is required. So it can also minimize the potential of lost or damaged information. So also we can go with we can have compliance to the regulatory and legal documentation requirements will be done with this particular part. And also there are other types. When we talk about the nursing documentation, mostly we can see there is a proprietary documentation, or you can call it as a quality reporting compliance will be there. Medication reconciliation can be done, automatic vitals recording, patient tracking. So already I told about the apps. And inventory management could be done with this. Time and material building could be done. Nursing history evaluation and pre-procedures could be planned and done. And nursing intra-procedure evaluation, post-procedure evaluation could be done in this. And also we can go with the nursing discharge and charge summaries could be included in this. So also when we talk about the electronic documentation software, it is a productivity tool. What is productivity? It is going to analyze the data deeply. It is also going to completely technically be helpful for the healthcare professionals, mainly for the decision making. It is going to collect mostly data from the various sources, and it is going to go for the entry. And it's very important, it's going to empower the health professionals as well as the patients, because they can get the updated records. Also, it is going to help the patient to have a portal access. So also we can see they are going, mostly it is going to have a smooth operation and compatible operation, and patients and care providers are going to completely go with a proper effective care, and effective communication will be mostly it is going to be exchange of transfer of communication and care will be rendered very smoothly. And also we can check the status of the patient and the progress of the patient at any time, anywhere. Also any places. So the document mainly, we can see it is going to encounter, also it is going to support the clinical decision making, and also it is going to track the practice financial performance also, because administrative expenditure also to be taken into consideration. And also it is going to document the patient records with timeline. So from the entry till exit, the timeline can be completely made without any haphazardness or without any confusion. And value-based care. So wherever the hospital personnel, the organization is going to go for a value-based care, because we know very well every multiple health professionals will do their role, and there won't be any confusion because of the digitalization. Also, the future of nursing care is mainly, it is going to be completely, this is going to be the future of nursing care. And also we know very well the storage, we know it is completely going to be flipping to the filing process to digitalized storage of the records. And it's going to minimize the regulatory burden, administrative burden, and also it is going to protect the privacy, client privacy, where it's going to be less risky in terms of privacy breaches, because even the records could be taken by anybody. But this, if you're going to lock it, if you're going to have a password, if you're going to only access is given to only the person whomever is required the login access, nobody can browse it or nobody can view that. Also, it is going to be helping the healthcare practices mainly to go with the smooth running, and also the backup can be done properly. Sharing of the information could be done effectively, and portability, wherever we can go, we can carry, and it will be reliable. It will be very quick for access. Also, it can create and store all the data, especially it has a digital spacing. So we all know very well now the cloud computing is there. Even the big data could be stored. And also we can store in the cloud, and encryption login could be there. You can cut the paperwork, and also only authorized people are going to use. So misusing will be completely stopped. And patient software is very, very important, because patient can understand that this particular software will be very useful for the patient, because they can completely handle and they can also understand about their health status. So software, when we talk about that, nursing documentation is going to be increased day by day. It can be used by the nurses because software has become very costly, and it is the integrity that is being imposed on the patient, medical and nursing expert and healthcare organization. It has become a necessary evil. So everybody has to learn this, and right decision-making tool and secure, mostly the data access should be very much secure. And timely use is very important in this case, and it is going to be a gateway for all the organizations to access this electronic information, and it is going to increase the healthcare professional engagement with the electronic software in the future. Also, we know very well this healthcare industry is creating many new leaders because they wanted to accommodate with the economic realities. So all the leaders of nursing should be equipped, and they should know how to be engaged with this particular software, mainly to be all the youngsters, especially all the young generation who are watching this. Tomorrow, they are going to be the leaders. They are going to be the leaders of nursing profession. So naturally, they should be completely engaged, and they should be completely become a techno-savvy in usage of this. So they have to progress. Mostly this focus is mainly on the productivity and cost cutting measures, and it is also boosting the patient care quality. And we can also know the updation of the records is very important and can be taken from the professional, any healthcare professional desk at any time. Also, because we know very well, it is being used by all the medical interfaces. Everybody is going to multi-disciplinary tasking is very important. So everybody is going to involve in this, and it also going to completely increase the revenue because value-based care system is going to give the quality care and also decrease the nurses turnover and all the healthcare professionals. The satisfaction, so the patient satisfaction and even the worker satisfaction is going to completely increase the revenue of the organization. When we talk about the attributes, what are the attributes that is required is mostly everybody should master the technological tools and information systems and training. Mostly if you see the training with electronic documentation is very, very important because that is going to be the gateway for the nursing informatics, and also the electronic documentation and practice. Mostly if you see, it is very, very important because everybody should go with the subset of information, and everybody should have a computer technology skills, and all should be flexible and adaptable to this because age and experience, nothing matters. Everybody is knowledgeable, everybody is same. I think nurses are even the older nurses, I think they are comparatively very good technical experts than even the young nurses nowadays. So everybody should do it. So there was some studies that has been conducted by Moody et al. And Alquarani et al. So mostly what they say is there is a positive correlation mainly between the age and experience. So also the attitude. So these three things are very important. So young nurses and experienced persons are mostly, they are able to adapt to this. Also the positive attitude is very, very important to get adapted to this particular nursing documentation with the use of electronic softwares. So when we talk about this, we need to empower everybody. So how to empower the nursing professionals? So we have to go with the productivity reward should be given, strong support from the administrators mainly. So also the curriculum, completely the curriculum development and professional development needs to increase. It has to have this. So today also I saw the theme is mainly to navigate this particular one. So navigation should be increased. How to increase the navigation? So we can go with the competency and comfortability should be given to them. So we have to we have to give them the training. That is very, very important. So educators integrate the electronic documentation mainly into the curriculum. That is more important. So when you're going with the curriculum, that is, so the principles and practice of the documentation, the function, the role, and also the relationship with the patient assessment and care planning should be included in the nursing theory. And with the nursing theory, we have to go with the practice. So the hands-on practice could be given by simulation exercises, building the student familiarity and the faculty familiarity with the electronic software. So with the training only, they'll be able to use it. Also, the system should be user friendly. So the system, whatever they are going to use, we have to make them to understand it correctly, and they have to use it properly, and sufficient funding. So for this, financial assistance is very important. So that should be given, and good rapport and the vendor support should be completely given. And third party technical support is very, very important for this case. And also when we talk about the students and faculty, proper orientation should be given regarding the theory. And then we have to go for the hands-on practice, and ample time should be given. Regularly, they should practice. Ongoing evaluation should be done. So the learning practice cycle should continue. So expectations, whatever expectations should be there, it has to be managed. For example, eventuality, whenever they are going to learn something in the classroom setting, when they go to other settings, the same type of software should be there. Otherwise, if there is any mismatch, this eventuality is not there, means they have a fear, they'll not be able to work. So it has to have the same kind of software has to be maintained across the globe, so that it will be easy for everybody, and the same caption, same kind of software is very, very important. The components is very important for them to utilize it wherever they go. So according to Chung and Cho, 2017, they done a study. Mainly the study is mainly to understand the impact and value of the documentation. So here they found out that EHR, that is electronic health record, helps mainly to prepare the students in information technology, and it is also helping for the problem solving and critical thinking. It is improving the critical thinking skills. Also, the students value electronic documentation according to Mountain, Red and O'Leary, Kelly and Guides. What they say is the students are very much keen to use this in the classroom and in simulated practice. So we all know very well, nowadays younger generation are very good in the technology. So if you are going to give them, they are very happy. So instead of going with this paper documentation, this will be going to become a very effective one in the future course also for the nursing professional. So we have to go into this legal aspects, because whatever may be, the legal aspects has to be considered. So federal privacy laws are very much there, because they are providing the umbrella rules mainly regarding the privacy and protection of the personal information, the health information, mainly which is going to be legislated. So we all know very well the cyber crimes. Even when we talk about the mobile phones, we all know very well how much of problem we are facing. All the time alert is coming. Don't attend this call. Don't attend this call. Don't go into the link, because you are completely, your informations will be completely, it will be stolen. So we have to be very careful with the particular aspects, because the information of the patient should not be leaked out. It should not be stolen, because it is going to go against the ethical consideration. We have to be very careful. So healthcare professionals are very much responsible to completely maintain this and protect the personal information and maintain the confidentiality. And the data should not be shared with anybody. Whomever is going to be involved, only they should have the access. So that is very important. So, but so much of advantages we have seen regarding this, but why the barriers are existing? Because the cost, because I told you financial assistance, technology needs a finance. The computer should be there, laptop should be there, tablet should be there, and people should have at least a smartphone, which is big enough to store the data. If you're not going to have, so the cost is very, very important, mainly to select and implement the electronic systems, and lack of infrastructure. So if you don't have a computerized documentation, it's not possible. And everybody should be able to accept the new technology. So if they are going to resist the change, it's not going to happen. So we all know very well, it is like Levin's change theory. We have to implement it. And we have to make every nursing professional, the faculty and students, to completely go into that. Then only the who are going to go to the healthcare industry, they'll be able to use it. And also time to adequately train and completely give them the support for all the employees. And problems, if there is any problems with the computer equipment, that is also a problem. Similarly, sometimes why nurses are not interested in this is, so you know that, hello? Okay, so those, they know very well there is a problem, like there is going to be a documentation burden, but still why they are not going, this is going to reduce, but still why nurses are resisting is mainly because of the fear, sometimes anxiety, sometimes they have anger. That also may be their the behaviors. Resentments, sometimes there may be confusion in handling this, exhaustion. They'll become very tired in handling the technology, and irritability to handle, how to handle the technology. That is why we need to go with the adequate training. So coming to the conclusion, technology, we all know very well, it is changing fast, and the world is changing with it. So change commonly occurs within the healthcare environment, and the transition from paper to electronic documentation is going to help nurses mainly to meet the complex healthcare needs and demands. So implementation of the electronic documentation can be very much challenging for the nurses. I told about a lot of barriers, because they are having a lot of resistance to the change. But if successfully adapted, so it is very important for everyone. So all the faculties, all the students who are here, and all the healthcare professionals, nursing professionals, completely everybody should be able to completely adopt the change. They have to accept the change. And this is going to become a great advantage in rendering a effective and efficient quality patient care and outcome. And it's also going to help in meeting the professional and organizational goals, and mainly for the overall success of the healthcare institutions. So thank you for the opportunity provided. I think I have covered all the aspects of this, whatever is being required. If there is any questions, you can ask. Thank you.
Thank you very much, ma'am. It was a very detailed session, and all our audience got enough information regarding the electronic media, or what are the electronic gadgets can be helpful in the nursing profession. We are very thankful for your provision, madam. Thank you.
Thank you. Thank you so much. Thank you so much for the opportunity once again. Thank you.
మేడం క్లోజా? అదే మేడం టుడే ఇంటికి బాగుంది. ఒక్క నిమిషం వాడికి ఫోటో తీయాలంట. ఎవరు?